Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Be healthy. Be informed with ITD. Healthy. Be informed with
Habiba islasen para honra, para gloria. Habiba islasen para que todo tempo e paz para ita dan langit na bendición contra peligro na fansa fuham Deus protegis Guam contra peligro na fansa fuham Deus protegis Guam. Living in this
my gang? First issue, Chamarita Girl, Friday.
Good morning.
Good morning on you. Containing COVID's KUM News Takeover. Good morning on you to our listeners out there in Radio Land.
And Facebook Live.
Yes. Wow. We have got a big, huge show for you. There's a lot of rapidly evolving information that's going out there. And I guess, first of all, we'll just start with the latest JIC release that came out last night, and then we're going to get to the whole cast of characters for this morning's episode of Containing COVID. Sabrina Salas-Manzanati, good morning.
Good morning, everybody. Your latest update from the Joint Information Center that came down at around 8:30 last night. On Thursday, 38 individuals were tested at the Public Health's lab. 8 tested positive for COVID-19. A total of 308 tests have been performed since March 12th, with conclusive results to date. A total of 45 cases have tested positive for public health and 263 cases tested negative, with 1 death. All 44 remaining cases tested by public health are in isolation. Additionally, Joint Region Marianas, working with the government of Guam, coordinated the transport of 4 sailors who tested positive for COVID-19, but we've got an update on that. So 45 positive cases confirmed by public health, 4 positive cases from the USS Theodore Roosevelt. And again, we'll have an update on that. But first, I think we want to get to our interview.
Right. So let's start off the show here. And there's been such an outpouring of support and people who are kind of coming together to offer more guidance in these strange times of COVID-19. And we're going to get Mike Pangilinan from Calvo Fisher and Jacob to talk about, they're doing a task force and a website, right, Mike? Good morning.
Good morning, Chris.
Hi, Mike.
Good morning, Sabrina.
Tell us about this task force that you guys have created.
Yeah, so we're a law firm on Guam that's been in business for almost 30 years, Calvo Fisher and Jacob. And we just sort of felt like all the information that's been coming in, we're really living in an unprecedented time, dealing with issues and problems that we've never faced before as a community. And there's just so much evolving information. Every day or two, there's new legal issues that come up that need to be addressed and that everyone in the community needs to know about. So we've decided that to help out, we've created a task force within our law firm, and our law firm has a San Francisco office, which puts us in a position to have some of our attorneys working in the mainland time zone, and that can be monitoring the information as it evolves out of Congress and as it evolves out of the states that applies to Guam. And a lot of information that you see people on their email, you may see these email blasts from different big companies or law firms in the states that disseminate information, but you never know whether it applies to Guam or whether it really affects anyone on Guam. So what we've tried to do is we really want to help the community to understand what's going on and what they need to be aware of. So we've got a website, and to access it, you just go to calvofisher.com, type that into your browser, you'll get to our main page. There'll be a link that you can click on, and that will bring you up, open up our special website that has summaries of all the laws that keep, coming out. If it's, it can be the local executive orders that are coming out that affect everyone. Also, the federal laws that can provide relief to local businesses, local employees, and the community, even public agencies. Those will all be summarized. You'll find like a really small summary right on the main website page, but then when you click on it, it'll give you a detailed explanation of how it can affect Guam and how it can affect the Guam community.
Right, Mike, because, with that... what was it, $2 trillion stimulus thing that came out. Someone has sent me one of the final copies, and this sucker is like 800 pages long.
Yeah, so that's the latest one that we're dealing with, and we've got people right now for the past 8 hours or so that have been combing through that. Of course, as it makes its way through Congress, it can change, right?
Right,
so,
right.
We're putting it up, summaries of what's in it now, how it's changed, what it's likely to contain. And so that's an ongoing process, but that's the most recent one that we're focused on right now.
Just from what you guys do know about the relief package, how does it apply to Guam? As far as what you guys have posted on your website.
Well, I mean, one of the important things that we're seeing right now that has a particular impact on us is the relief that it provides to industries that are particularly hard hit by this virus, and that would be the airports and airlines. So there is a provision in the relief package and the stimulus package that provides a lot of funding for airports. So it's about $500 million. There's actually $500 million to pay for airport improvement programs. That's of course, not all of that goes to a single airport.
Right.
But that's then $7.4 billion of other aid that can just provide airports, reimbursement for all of the fees that they're sort of having to forego.
Right.
During this period.
Mike, I think one of the things, of course, that probably the most people are wondering about are the direct payments to American taxpayers. I know that's still in flux, but you guys are kind of keeping an eye on that, because I think that's one of the things where people want to know who applies, how much do I get, are there caps on household income and all that kind of stuff?
Yeah, so I know that we have verified that it applies to Guam and all the territories. There's a lot of other possessions territories within the U.S. that it applies to. So I know that there's a $1,200 cash dissemination that's going to go to employees, and that's across the board. And then there's going to be funding for different different businesses in the community, the different industries. But it does apply to Guam. That was with all of these laws. That's the most important aspect that we look at first, is making sure it applies here. But it definitely does.
Right.
What about the unemployment insurance? Because we don't have an unemployment insurance program locally.
Yeah. So there's the other law that has come out that actually is a law now, is the Families First Coronavirus Response Act, and so the government's trying to get money to employees that have been affected by this situation, and so it's hard for the federal government to just send cash. I mean, it's hard to actually administer something that's that widespread. So what they're trying to do is to get employees a benefit somehow quickly, right? So one way that they're doing it is with that law, it allows employees that have to be quarantined, or they have to stay home because their children, the school closures have affected their children. They can get paid sick leave that the employer has to pay, but the employer can get reimbursed or refunded the sick leave through tax credits. So that's a kind of an innovative way to get the employee actual payments, that can be done through the employer. So that way that they can get the money right away.
Right.
Yeah. So that one is already in effect. Definitely applies to Guam.
I mean, it's a lot to unpack, and so how do you guys go through these things? And I mean, I'm pretty sure, I don't know if dumb it down is maybe unlawyerify it is probably the better term, but
yeah, I mean, that's right. It's not easy to do, obviously, but this is our job. We're not frontline responders, right? We're not medical professionals. They're the ones that are putting their lives on the line, that are on the front lines. We're not, even the grocery store clerks, they're out there taking big risk for all of us, right? But what we're trying to do is just, what can we do? Our normal job is to take information and make it usable and understandable. So we have people, going through it, dedicated to this. And we wanted to put it up as something that's easy to access, so you don't have to, it's not only people that have lawyers that will understand it.
Right.
We want everyone to be able to understand it. But yeah, we've got relationships out there in San Francisco with our attorneys out there, connections to the other firms that have kind of specialized expertise. So we're also tapping on those relationships to help us kind of do this quickly.
All right. Well, thank you. Anything else that you wanted to get out, Mike?
No, I just wanted to also just mention one other sort of highlight on the site is the SBA Small Business Administration loans.
Right.
Those are available to businesses on Guam. and there's an application process. It's online. You just have to go to their website, and there's a specific type of loan for this COVID-19 disaster. It's similar to the SBA loans that you get in a typhoon, but specific to this. So it's available to Guam. It's up to $2 million of a loan that you can get that's subject to potential forgiveness, depending on the circumstances. But it's something that I would recommend that businesses definitely take advantage of.
Well, Mike, we'd like to, I don't know if we can keep you on retainer or anything, but as some of this stuff goes through the White House, the president signs it. I mean, obviously there are going to be some last minute changes as they wheel and deal. But we'd like to have you, handy. I mean, we got your number and call, maybe kind of decipher a lot of this stuff and,
unlawyerify it.
Yeah, unlawyerify it so that the people of Guam can know what benefits are, available for them. And that's
absolutely. You guys know where to find me, and we're available anytime. We just want to help, and we'll all get through this together.
You got it. So
Thank you.
you're an early riser, Mike, so 6:05. We'll make this.
Talk to you Monday.
Okay.
Okay. All right. Take
There
care.
you go. Attorney Mike Pangolina and Calvo Fisher and Jacob. So that's neat. We posted the website link up on the comments. And he's right. There's a lot of stuff going through it. I remember when a friend of mine sent me the stimulus thing, and of course, I want to know. I think people are like all about the direct payment, so I was trying to go through it, and when I found it, I was like, what language is this? Right there too, whereas thingamabob. All right, containing COVID. So, Bree, I know we have some new developments. Everybody has been talking about this USS Theodore Roosevelt, now being called, I see in some national media reports, the COVID carrier.
Yeah. And so, overnight, we had actually been monitoring this. And initially, the military came out, was it Wednesday, I believe, where they confirmed that there were 4 sailors that were medevaced to Guam from Theodore Roosevelt. And they were medevaced to Naval Hospital Guam, and they were on home isolation, or not home isolation, they were isolated. And so yesterday, Nestor Lecanto, during the media briefing, which, by the way, we're only allowed 2 questions, all media, posed the question about whether or not the ship was going to be coming to Guam. And I believe we have that question. Yeah, can we play that?
As you are aware, the Navy announced yesterday that there were 4 sailors
So
from
again,
the
this is
USS Theodore that had contracted
so there are new developments regarding
the virus
the ship
and are now
pulling
being
into port, but we
treated
did
at
pose
the
the
Naval
question during the
Hospital.
press conference
It's
with the governor.
very conceivable that many others on the close quarters within that carrier also contracted the disease. So is it conceivable that that ship may have to come to Guam and port here and also quarantine dozens, if not hundreds, of other sailors? And what is the contingency by the local government if that were to happen?
So, Nestor, I have been in close communication with Admiral Minoni. He's been very transparent with me, and we have had discussions. I would like to defer the question to him because he is the official person that would give you that information much more appropriately. So could you ask him?
We did, and they wouldn't say anything. But are you aware? Have they talked to you about that particular scenario?
On his behalf, I would defer to him because he is the official commander and head of this part of our naval military facilities.
What would be your reaction then, Governor, if they had to bring the carrier here? Because you did stop the cruise ship from coming here that had passengers with the virus.
Acting Navy Secretary Thomas Modly, he confirmed that the USS Theodore Roosevelt was pulling into Guam after several sailors tested positive for the coronavirus. And, we're hearing it could be up to or more than 20 sailors aboard that ship testing positive. Modly said they are in the process of testing every member of the crew 100%. Reportedly, again, more than 20 have already tested positive. 4 sailors, as I mentioned, were medevaced to Naval Hospital on Wednesday and are in isolation. He added no one on the ship will be allowed to leave anywhere into Guam other than pierside. The USS Theodore Roosevelt is described as a floating city with around 5,500 Navy personnel aboard, 20 of who are originally from Guam. And the aircraft carrier is home ported in San Diego, California, and recently was actually on island on February 7th. And I know that we actually covered that story when the ship pulled in, and you were the reporter.
Yeah, I actually covered that story. So me and our videographer Byron went down to I forget what they call it. It's the pier where the ships go in. There's some military name for it. But yeah, there was 20 some sailors from Guam on that ship, and so that's kind of what I was thinking about last night. Was I mean, there's just so many sides to this issue. But I kind of thought as I was putting myself to sleep last night, what about these sailors from Guam who are on this ship? And
so we want to actually hear from family members if you know anybody, because like I said, there were 20 sailors on board that ship. So if you have a family member that's on the USS Theodore Roosevelt, please give us a call, 637-0094. And you know, I was reading some of the comments when this first was posted on Facebook, because they post their Pentagon press conferences, and so there was a press conference 2 days ago.
I just got to say that was just to me it was very shameful that the governor had talked to Admiral Manoni, and it was apparent that she knew about the carrier coming because she deferred to him. So I just felt like it was really problematic for me that we had to go watch a Pentagon press conference, thousands of miles away to find out what's happening right here when the most highest elected official in our land knew already. So it was frustrating.
She could probably argue that, for national security reasons.
I highly doubt it. I mean, and I think that maybe she doesn't have a clear understanding of what you can say.
And the local military, they don't comment on operational whatever thingamabobs.
Yeah. So I actually have the clip now, and I'm going to go ahead and play it.
Which one is this?
This is Nestor Lecanto.
This is the governor.
Yeah. So he had asked the governor what she was able to tell us about the Theodore Roosevelt docking on Guam. This is from yesterday's press conference.
I have been in close communication with Admiral Manoni. He's been very transparent with me, and we have had discussions. I would like to defer the question to him because he is the official person that would give you that information much more appropriately. So could you ask him?
We did, and they wouldn't say anything. But are you aware? Have they talked to you about that particular scenario?
I would defer to him because he is the official commander and head of this part of our naval military facilities.
What would be your reaction then, Governor, if they had to bring the carrier here? Because you did stop the cruise ship from coming here that had passengers with the virus. What is your view on that?
Nestor, I think the governor answered your question.
Oh, man.
Cut off.
Right. She's the left tackle. You ask a tough question, Janella comes in. She's like, nope, sorry.
Mute. Yeah, so the way the press conferences go is that every media gets one question, and then you get a follow-up question for a total of two. And once they go through all the media, then the press conference ends.
And, it's funny because there was a Facebook comment on our live stream, I think it was a couple days ago, and I forget the name of the person, but they had put something along the lines of like, hey, can you ask the governor the questions that we're asking you to ask? And we really try to. I mean, really, and we see these questions when you guys put them on the Facebook comments. We see it. That's kind of our whole nature, that we want to ask these things that you guys want to know about. So we do see those questions, Facebook viewer, and we do remember them. We make little notes to ask people. But as you can see, this is a rapidly evolving situation, and sometimes you just don't get the opportunity to make those asks.
Right. So we do have a clip from the press conference at the Pentagon. And, as I mentioned, the aircraft carrier is being sidelined after 3 COVID-19 cases, or that's actually 4, in the crew had turned into at least 8. This is one of the latest reports from USNI News, forcing the ship to pull into Guam while the entire crew is tested to figure out the extent of the outbreak. But we've learned that it's actually over 20. So here is the press conference from the Pentagon.
I also want to give a quick update on the Teddy Roosevelt, which we spoke about the other day. We found several more cases on board the ship. We are in the process now of testing 100% of the crew of that ship to ensure that that we're able to contain whatever spread might have occurred there on the ship. And but I also want to emphasize that the ship is operationally capable and can do its mission if required to do so. So the ship is pulling into Guam. It will be pierside. No one on the crew will be allowed to leave anywhere into Guam other than on pierside. And we are already starting the process of testing 100% of the crew to ensure that we've got that contained. The sailors who have been flown off the ship are currently doing fine. None of them have been required to be hospitalized because their symptoms are very mild. They're aches and pains and those types of things, sore throats, but nothing that required hospitalization. So they're in quarantine now on Guam.
Navy Secretary Thomas Modly during a Pentagon briefing confirming that the USS Theodore Roosevelt was pulling into Guam after several sailors tested positive for the coronavirus. There's multiple media reports that the actual number is over 20 that have tested positive. And if you don't know, there are over 5,500 sailors aboard that ship. And also, U.S. Pacific Fleet comments that the USS Theodore Roosevelt had already planned to pull into Guam for a port visit even before the COVID-19 outbreak began.
Yeah, so that we're really just trying to sift through all of these national media reports and kind of compare that to what we were able to get, which wasn't much.
It was interesting because in the Pentagon briefing a couple days ago, they were saying three were being medevaced to Guam and tested positive, but Joint Region Marianas, in their press release, it said 4.
Right.
And now, they're not giving us any information.
Of course. Yeah, it's very frustrating. One of the things I saw, though, if you're following these national reports, and I think I heard it in this press conference, was that they're going to test all 5,000 something of those sailors on that ship.
100%.
Yeah, and so I think it was said during the press conference that they only have about 100 test kits now, but they're getting a bunch flown into the USS Theodore Roosevelt.
You saw that in the press?
It was on the press conference,
wow.
Yeah. So I'm thinking, since the governor calls Admiral Maloney every day, and he's so transparent with the elected leaders, at least not the people of Guam, that maybe we can ask for some of those test kits.
Yeah, I actually was trying to see if U.S. Naval Base Guam on their Facebook page, whether they're providing updates to people in the military or on the Navy base on the USS Theodore Roosevelt, but I hadn't found anything. I know early on when he declared the public health emergency on base, you saw him give a direct message, but I haven't seen anything. And I don't know if it's, they're not allowed to.
I think they're just scrambling. I mean, this is rapidly evolved over the last, 12, 14 hours,
Yeah, it's interesting. I wonder how the military, Naval Base Guam is going to handle this. Are they going to be like, no one comes in?
Yeah. And that's something that we were getting on WhatsApp. It was going around on WhatsApp yesterday. I don't know if you saw those messages where people were saying like, oh, we're hearing that, the Navy base is going to get locked down. So I actually sent a request over to the Navy. And the other thing with the military, it's like if you don't send the right request to the right public affairs officer, like, good luck getting a response. So what I do is I just bullet blast all of them.
Yeah, all at in one shot.
I CC all 58 different military public affairs people on Guam and shoot out a message. So I did. I said, hey, are you guys going through any additional measures, precautionary wise, or is there going to be any? And I tried to use my military speak, so I was like, are there going to be any more COVID-19 forward postures to go on? How's that?
Military speak. So now we got to decipher military speak and lawyerify.
Lawyerify. And then, okay, we're going to take a break here. We got some news, 6:34. Again, we're really trying to get you as much as we can on this USS Theodore Roosevelt, which has pulled into Guam and presumably also carrying those 20 some sailors who are from Guam, who have Guam connections.
Yeah.
So, I mean, what a homecoming for them.
But the military did say, the U.S. Pacific Fleet, that it already had planned to make a port call in Guam. It was just here, like you said, in February.
Yeah, and so what I saw and just looking around on the internet last night was that it was coming from Vietnam. There was some kind of anniversary of Vietnam or something, and so they had been over there. So I'm guessing they were just coming back.
And they had confirmed cases right in Vietnam at the time.
Yeah. So let's do news here. It's containing COVID. Again, 637-0094. That's our number. We got Alex from the Department of Public Health and Social Services to talk again about prevention measures as we are now in day 12 of a government-wide shutdown.
With a total of 45 confirmed cases.
That's right. So there were 8 positive cases last night of COVID-19. And let's do news now from the KUAM News team. Good morning, Guam.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Be healthy. Be informed with ITD.
because it can. A day for a sauce so special they put it on there twice. A day for McDonald's most McDonald's burger. So go, because today's your day for a Big Mac.
Now available in 3 sizes, including the new Little Mac and Double Big Mac burgers at participating McDonald's for a limited time.
Subway's got fresh choices for this Lenten season. Sink your teeth into the savory goodness of our shrimp and guacamole spinach wrap. Or go green with our delicious Veggie Max, a delicious vegetarian patty, free of artificial colors and flavors. Don't forget the classics like the tuna or seafood sensation subs, all made with freshly sliced vegetables, prepared daily in every restaurant. Visit any of our convenient locations today. Subway, make it what you want.
Living with diabetes can be difficult. Eating to manage your diabetes can be even harder. Let the Boca Box make it easy for you to manage diabetes with our 6-week diabetes management program designed by Dr. Luan Nguyen of New Gen Physical Therapy. This diabetes management program includes specially designed meals, diabetes management classes, cooking demos, and shopping tours to help you understand how to use food to control your glucose, lose weight, and improve your numbers. Sign up now and take control of your diabetes. Contact the Boca Box at 922-2652 for more details. You can also follow us and message us on Facebook and Instagram.
NBC Primetime Tonight kicks off at 7 with Superstore, Brooklyn Nine-Nine, back-to-back episodes of Indebted and Law & Order Special Victims Unit, followed by KOM News Primetime and NBC Late Night, KOAM TV8, First on Guam.
This primetime lineup is brought to you by Docomo Pacific, better together.
Why yo, why yo, why yo, why would baby girl?
Bendis. Sorry, guys. I kind of want to do the whole like Friday yell that you're probably all expecting, but there's a lot going on this
Not
morning.
in the mood.
Yeah, not having it right now. 8 new coronavirus cases, and we're also following very closely for you the USS Theodore Roosevelt. The ship is in.
Not
the ship you want, though. This is the COVID carrier, and it's rapidly evolving.
Got to pray for all the families, that have someone on that ship, especially considering the fact that 20 also are from Guam. So our prayers go out to all of you. Hopefully,
I'm trying to go through my phone because I remember that I had WhatsApped one of the family members of one of the sailors who came in on the Roosevelt back in February. To maybe try and get a hold of him, but WhatsApp, it's like if you don't save the number, boy, it's a whole lot of searching.
No, you can.
Oh, I can.
You can do that. You just go into search and type in like the keyword.
Type in like the ship is in. Okay.
I don't know.
642. Let's go to the phones here. 637-0094 and get Alex from the Department of Public Health and Social Services on the line. Good morning, Alex.
Good morning, Hafaday.
Hafaday.
Thank you.
And so we wanted to kind of call you up to get maybe some more COVID-19. Are we doing prevention tips, Alex?
Well, you know what my role specifically is to provide education and community health outreach, but I also work with our individuals and their families living with COVID-19 on a psychosocial level, because there's a whole new set of cultural norms and changes that are being challenged right now here on the island, and I know you could feel it as well. And that's important for us to make sure that they're taken care of.
Are you part of the? Do you go out and visit? What did you say? You're part of the? You answer phone calls or?
Yeah, so I work with patients who are assigned to me living with COVID-19 when they need psychosocial help, because there's separation that's unexpected. They're unable to have contact with their families, face to face.
Right.
Immediate changes. Yeah, it's really dramatic.
Alex, this is wow! I had no idea that's the type of work you're doing. So you actually work as a counselor for people who have COVID-19 on Guam.
Yes. So I get the referrals from our nurses at Northern Regional Community Health Center, and then we make initial contact through cell phone. And I also work with their families who are not in isolation or in quarantine, because they have like millions of questions regarding the status of their loved ones, what to do in case of an emergency, for example, an untimely death. They think so far ahead, Chris. We talk about the funerals already, and I try to let them know that not everyone with COVID-19 dies, right? So we try to instill some hope in everyone.
Mm-hmm.
Alex, what are people with COVID-19 saying? Because it's a virus that kind of goes from low to no symptoms. Some people have it; they're asymptomatic. To obviously the very tragic side of it is where we have Monumco with these comorbidities like Dorian Jesus, who succumb to this virus, which in those cases becomes fatal. So what do they say?
Yeah, because there's a lot of unknowns. A lot of the presumptions include the fact that they think there's a vaccination and treatments for COVID-19, and there are no vaccines, and there's no treatment right now. We treat it as though it's pneumonia. That's how the peripheral treatments are being performed now. But we've lived through SARS and MERS and dengue and H1N1, swine flu, and they have treatments and vaccinations already, but not so with COVID-19. That's why it's really important that we let people know we don't have vaccines. If we did, of course, we would distribute it out and have everyone vaccinated. But one of the things that people are concerned about living with COVID-19 is, why am I not being vaccinated? Why don't the treatments come to us? Well, because they don't exist. And right now, that's completely demoralizing if you have COVID-19 and you are more sick than other people, because you're right, there are different lethalities and different modalities and different levels of the COVID-19 disease. So that's one of the things that we try to let them know. Keep them updated, keep them optimistic, but also make it real for them.
How many people from public health are doing what you're doing?
Right now, I'm a team of one, and I work with our nurses that are fantastic. Understandably so, we're short-staffed, but we're trying to staff as many people in as possible. So we do what we can, and with the alarming numbers of people going up, I'm sure I'm going to have other people come and join me.
Right. Yeah. So how does it work, Alex? When you wake up and you go to work, we've got how many positive cases now? 45. 45.
Well,
do you just go down the line and you try and get a hold of all 45?
No. What the process is, the nurses who have the actual face-to-face contact with them relay the message to me, because not everybody is ready to talk about their disease. Not everyone. We're not going to force them to say, "Tell me how you feel."
Right.
It's not the typical social work model, right? We're not,
Such a loaded question. Tell me how you feel.
Yeah, it's and it can be painful because you're going through something really traumatic, and sometimes you need time to process what's happening. Why am I here? Who infected me? Who did I infect? Why isn't so-and-so doing more to help us out here? And when you're isolated and you're in quarantine, you're really disconnected from the outside world, so you don't get the feel of what's really happening, and you're angry and you're anxious.
So are they angry, Alex? And what are they angry about?
Well, a lot of the anger stems from the fact that it happened to them, and we let them know that this was not intentional. And if they infect somebody, perhaps they did not do it with malice. This is something that's new. It's something that we had heard about late last year, but we try to let them know that you're in care now. Let's contain this. And when and if that vaccine and treatments come into place, then you will be able to have that for yourself. That's why today, right now, we're still seeing people out and about. It's just crazy that people are still congregating in groups of 10 or more. But we let them know that our patients, that we're doing our best to prevent other people from being infected.
Mm-hmm. So you talk to the patients. Do you talk to the family members as well?
That's correct.
Mm-hmm.
Yes.
Do any of them have any concerns about their children? What should they say to their children about this? Because you would think that there's so much anxiety.
There's a lot of stress and anxiety because when you talk about your immune systems, and as children, they don't have fully developed immune systems, for example, like you may have, and the fear of loss. When you hear the deaths around the world, it's accelerating. The curve is not being flattened at all. It's actually expanding. A lot of children don't know this, and like you and I, we have not lived through a pandemic at this magnitude. So the fear for children is even greater. Why am I not in school? Why can't I see my best friends? Why can't I have my baseball practice? The socialization pieces are no longer there. So now you're confined, or you stay at home and you're very limited with your contacts. And that is also troubling for children. The whole piece about going to school is you learn from others. You learn different cultures, you learn different language, different ways of life. And now it's taken away from them. So the children also wonder, where's my loved one? Or why can't I see my uncle or my father? Because of the social isolation piece and social distancing, especially if you're a first responder. Like, for example, with me, I had to say goodbye to my mother. On the first day they announced the first 3 cases, I had to say, okay, Mom, this is it. I can't be with you anymore. So I haven't seen my mother in about 2 weeks now, and we have to do that so that I won't infect my mom in case of my exposure to the work that I do.
How does that make you feel, Alex?
Oh man, her birthday was 2 days ago. She turned 86, and it was the first time in my life that I wasn't with her on her birthday.
Wow.
So I'm indebted. She's in Barrigada, and we agreed. And she's a smart woman. She said, we will see each other again when it's right, when the time is right. So I'm hoping other people can espouse that covenant, because you're talking about people's lives here. And she's elderly, of course, and initially we thought that it's the elderly folks who were most at risk. But statistically speaking, in the U.S. mainland, more than half the new cases are between 18 and 45-year-olds in the mainland.
So I wanted to ask you about that, Alex. We have, in seeing the demographic breakdown, there are some COVID-19 positive patients in their 20s, 30s. That's still pretty young to a lot of people. And these are the ones that Dr. Felix Cabrera, we had him on. He said that these are the carriers, these are the vectors, these are the ones who are mostly asymptomatic.
Mm-hmm. You're absolutely correct, because they could be asymptomatic, but they could still pass on the virus to another person. And if you're a young person here, culturally speaking, we have a very closely knit culture, right? You amen, you kiss, you embrace each other, and we want to make sure people understand that's one of the ways that you could transmit this virus. So it just challenged our culture quite heavily here.
Right.
And so, in talking to those younger people, what's their feeling? Have you done any counseling with some of the young ones?
Not the very young. I remember a long time ago, I used to be young as well, and you have a feeling of
invincible. Yeah, you're invincible.
Chances, you drink, you smoke, you drive real fast because you're young, and it's a thrill. And there was an instance of a group of young people in the mainland who had a coronavirus party. They purposely taunted each other to get infected, and they did. So one person became hospitalized, and I'm not sure what that person's status is, but that's not what you do. You don't make fun of a crisis because you put your life at risk, and others as well. So we let people know, yes, you're young, you're still strong, you can be asymptomatic, but you can carry this and transmit it to other people. It's your responsibility to know the facts, right, and understand it. This is something that can be contained. We can get past this quite easily, but we have to listen to our health professionals and also to the media outlets such as yourself. Great, I-94, fantastic. You have a young audience, and I hope they're listening now, because whether you're driving or working out, you have your health. You have the rest of your life. So let this begin the first day of the rest of your life and do the right thing.
All right. Well, thank you, Alex. Anything else you wanted to get out?
No, I just want to say thank you, I-94. We really appreciate that at Public Health. You've been so good getting the word out, and we appreciate all that you do. So thank you so much.
Wow, Alex. So you have a great Friday, and say hi to your mom for us.
You made my day. I will do that before I go to work. Thank you.
Yeah, you make sure, okay?
Happy birthday to your mom.
And happy birthday to your mom.
Oh, man. Thank you. Thank you so much.
Take care.
Wow, so that's another side of it. These
so
guys,
many different sides,
I mean,
right?
every day we're finding out there's a new side to this COVID-19 crisis.
And even what Dr. Felix Cabrera yesterday at the end of the show, he was mentioning how if you can help watch a child of a healthcare provider, obviously not your nana, but somebody, your auntie or whoever who can watch a child, so that healthcare provider can go to work and help fight this battle.
Right. So, Bree, we haven't even had time to go over who's going to be on the show. I wanted to get Mayor Ernest Chargaloff of Molesto on the line here, because there are a lot of COVID-19 positive cases in the South, as we've now got the breakdown of which parts of the island these positives are from. Also, from the Guam Hotel and Restaurant Association, we're going to get Mary Rhodes on, and Maria Leon Guerrero has organized a really cool GoFundMe, and we're going to talk about people who are trying to help and finding the right ways to help, so that the money you raise or the supplies you get are maximized, and to make sure that you don't go raising a bunch of getting a bunch of supplies that healthcare workers can't use, because there are the standards for the type of gear. So I want to talk to Maria about that. And then we're getting the Deputy Director of the Guam Economic Development Authority, Ricky Hernandez. I know he's making the rounds this morning, touting the recovery plan, right?
Economic recovery plan. There was some meeting, I guess they had with the governor's business advisors, economic advisors yesterday, and during the press conference, he was sharing briefly what they're doing to help the island's economy. So hopefully when he comes on, he can break that down in more detail for us.
And then Christina Boleto from the Guam Chamber of Commerce, of course, they got a lot to say about the economy. And also, we're trying to get Dr. Anita Enriquez.
Right, because UOGA, I believe there was an announcement about online classes.
Right.
So she'll provide more information on that.
Yeah, and you want to run through that JIC release again for those people just joining us on the Facebook Live. Good morning on you. It's Friday, I-94 also. We're KUAM-FM in Agati, Guam at 6:55. Sabrina?
Public Health, as of their latest update from the Joint Information Center at 8:30 p.m., Public Health tested 38 individuals for COVID on Thursday. 8 tested positive for COVID and 30 tested negative. That's a total of 308 tests that were performed since March 12th. And to date, total of 45 cases tested positive by Public Health, 263 cases tested negative. Now, that number does not include the number of positive cases that have been confirmed by the military. They have 4 positive cases from the USS Theodore Roosevelt. And as we mentioned earlier when we started our show, the USS Theodore Roosevelt is pulling into port if it's not already here. There's been multiple media reports that there are over 20 sailors that have tested positive for the coronavirus. And there are about 5,500 crew members aboard that ship. We heard from during the press conference with the Pentagon that all of them will be tested for the coronavirus. And just because it's pulling into port, the Navy officials have said that they're going to remain on the ship and pierside. They're not going to be allowed to go into the community of Guam. I'll have a breakdown now of the earlier confirmed cases. This was from Thursday, 37 confirmed cases. So the way that this works is that the JIC, they push out the press releases at night and then they break down the cases from the previous day. So what we know as of Thursday, out of the 37 confirmed cases, 25 are in stable condition, 11 were hospitalized, 1 is deceased. The gender breakdown, 16 are male, 21 are female. 11 are from the north, 16 from central Guam, 8 from southern Guam, 2 still under investigation for place of residence. Travel history, 1 from Japan, 7 from the Philippines, and 2 from the U.S. mainland. The remaining number of confirmed cases have had no travel history, which indicates community transmission. The age groups of the positive cases, 1 is in their 90s, 2 are in their 80s, 2 are in their 70s, 14 are in their 60s, 5 are in their 50s, 6 are in their 40s, 4 are in their 30s, and 3 are in their 20s. We also have a follow-up on the nurses. There was an investigation at GMH after one of the patients there came in and it didn't come in for symptoms of the flu, but other existing ailments. We brought you that story, I think it was last week. So GMH reports that the three of its nurses who were at risk of exposure for COVID-19 to a positive patient have tested negative.
Right.
So that
good news.
Right. The patient was initially treated in GMH's medical surgical inpatient adult unit, and that is in the 3rd floor, and was placed in a private room. And again, as I mentioned, later tested positive for COVID-19. The 3 nurses who were identified to have come in close contact with the COVID positive patient were immediately placed under quarantine and tested for the virus again. And again, the results were negative. From the Department of Revenue and Taxation, they've issued 5 notices of violation as part of its efforts to enforce compliance with the governor's executive order. The types of businesses that were issued the NOVs include a vape shop, sporting goods store, a video store, a sign shop, and a bar. Non-essential businesses remain in operation from March 20th.
I wish they would tell us
to March 30th.
what businesses so we can adequately shame them for opening.
Right, and these businesses, they're subject to revocation of their business licenses.
A bar, really? A bar?
Yeah. I mean, who's going to even the people that are going to the bar should be cited.
Yeah.
What the hell? The governor, she had requested for federal assistance for Guam. As we told you yesterday, she submitted a request for a presidential disaster declaration for Guam. The request is based on the direct detrimental economic impact of COVID-19 events beginning February 2020 to present. President Trump has the authority to declare a major disaster for any natural event that he determines has caused damage of such severity that is beyond the combined capabilities of state and local governments to respond. A major disaster declaration provides a wide range of federal assistance programs for individuals and public infrastructure, including funds for both emergency and permanent work. And also, I just wanted to pass along the number. Hopefully, I still have it here. You heard from Alex Silverio about how he is providing counseling for people who may be experiencing anxiety. And so there is actually a phone number.
Well, how many lines do they have?
They have quite a few. Hopefully
good.
I can find it.
Would you say that you're experiencing any anxiety, Bree, that you want to talk about?
Not on the air. And it's not anxiety related to, yeah. Yeah,
there's
all right, so
we're all dealing with things in this time.
Right. The public health counseling hotline numbers for COVID-19, and again, this is for people who are feeling distress or anxiety due to the pandemic. They provide live crisis counseling. The numbers are multilingual, text capable, and confidential. The numbers are 988-5375, 988-5375, 683-8802, and 686-6032. And the numbers are operational from 8 a.m. to 10 p.m.
Hey, and I wanted to I was passing this around in some chats yesterday. This is the alarming advisory that came out from the Joint Information Center. An important medical advisory, given the number of positive cases of COVID-19 accelerating on our island, and it accelerated again last night with 8 new positive cases. Consider yourself possibly exposed if you have recently traveled or attended any mass gatherings such as church, fiestas, small parties, or other gatherings within the past 14 to 30 days. For the next 14 days, stay home, self-quarantine, and monitor yourself for symptoms. If you feel any of the signs and symptoms of COVID-19, contact your doctor or healthcare clinic. Some of the symptoms include, but are not limited to, fever, sore throat, cough, runny nose, shortness of breath. Other symptoms can include diarrhea, abdominal pains, chest pain, headache, chills, and congestion, to name a few. One source of my anxiety, Sabrina, I just want to share with you and the audience, is when I wake up in the morning. There's that moment where you just wake up and you do your self-check, like, am I sick? Do I have a runny nose?
I do that too.
Right?
I actually do.
And I don't know if it's like my sinuses or something, but, when I eat Don't Eat Nancy, I get a runny nose. So the other night, I kind of was like, oh my God, I got a runny nose. Oh, is this it? Is this it? And then I remembered I was eating Don't Eat Nancy just anyway.
So whoever's answering those phone calls,
right.
Chris will be calling.
I'm going to be calling. Please clear a couple hours. But no, I'm seriously, people, maybe you don't know because it's kind of in our culture also to hold things in.
Yeah.
You know what I mean? To not talk about it, to carry your burden. And so that's why I feel like it's very important to call those numbers. And, thanks to Alex for, man, guy hasn't even seen his mom.
I know.
Since the first positive cases were. And that's kind of, when you want to talk.
You have to do.
When you want to talk about COVID heroes, those are the kind of heroes that we've been talking about since we started this show. Is these people who, sacrifice so much of themselves just to help out.
Not just to Alex, all of the doctors, nurses, first responders, even the sanitation workers, the security guard, the restaurant, the takeout, the grocery store employees. We could go on, and
we could.
Right, and please give us a call if you'd like to recognize anyone. 637-0094, and also tag us on KUAM News on your social media. We've been doing it for the past week, and we'll continue to do it because we're all in this together.
Yeah, and we're going to read some of the comments. I've seen some comments here coming in. We got somebody watching from Kentucky. So, Yeehaw. I don't know. Is that a Yeehaw state?
I don't know. Louisville?
Louisville. Okay.
Kentucky?
7:04. Let's take a break and do news. We're coming back with more containing COVID. And I think Nestor has got an update that, hopefully we can get. Maybe we'll get him on the phone. It's KUAM FM, Agotni Guam 7:04. Good morning, Friday.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Be healthy. Be informed with ITD. Healthy. Be informed.
Hey Guam, it's Jess from the Boca Box and welcome back to Boca Bites. It is day 7 of quarantine and I've completely stopped shaving, but I also just went to the store and picked up a bunch of groceries for the week. And I wanted to talk to you guys about cleaning and sanitizing your produce and the things that you pick up at the supermarket before it gets into your house. What we like to do is we'll get like a simple disinfectant, either like Lysol wipes or bleach and water, and then we'll wipe down the outside of the bags or anywhere that somebody has been able to touch the product. We'll wipe it down, disinfect it, and then take it into the house and store it in there later. The other thing you want to do with fresh produce is that we take it out of the bags, and then I have a solution of water and a produce cleaner like this, or you can just do soap and water, and just like you kind of wash your hands, you dump all the produce into the water, let it soak for about a minute or two, take them all out, and then what you're going to do is kind of like scrub them and wash them, and then wipe them down and then bring them into the house. What this does is it helps to minimize the exposure that anyone has had to the coronavirus, because the virus can live on plastic and metal objects for, a couple days. So we want to take every precaution to keep our families safe and just make sure that we're washing and sanitizing our vegetables and everything that we're bringing into the house from the grocery store. So yeah, we're here for the next couple of days. It's very, very tedious, but there's nothing else for us to do. So until next time, I'll see you guys on Boca Bites.
This primetime lineup is brought to you by Docomo Pacific. Better together.
Subway's got fresh choices for this Lenten season. Sink your teeth into the savory goodness of our shrimp and guacamole spinach wrap. Or go green with our delicious Veggie Max, a delicious vegetarian patty, free of artificial colors and flavors. Don't forget the classics like the tuna or seafood sensation subs, all made with freshly sliced vegetables, prepared daily in every restaurant. Visit any of our convenient locations today. Subway, make it what you want.
It's a celebration at Cars Plus Guam. During our Jeep celebration event, receive up to $2,000 off on the all-new 2020 Jeep Gladiator, the most capable off-road mid-size pickup truck. Customize your Gladiator the way you want it. Call 477-7807 or visit our website and get pre-approved online at carsplusguam.com today.
Dear people who haven't had a Big Mac, who saw millions of people enjoying something and said, no thanks. We're not giving up on you, because today is a new day. A day for a burger that has a bun in the middle because it can. A day for a sauce so special they put it on there twice. A day for McDonald's most McDonald's burger. So go, because today's your day for a Big Mac.
Now available in 3 sizes, including the new Little Mac and Double Big Mac burgers at participating McDonald's for a limited time.
Why pay full price? We'll help you save. Check out KWAM deals on kwam.com/deals for the island's hottest promos, sales, discounts, and so much more. KWAM deals exclusively on kwam.com. Find your deals today and let us help you save. Half a day from Matua's Bar and Grill. In accordance with the governor's mandate over the threat of coronavirus, Matua's Bar and Grill is closed for business. We want you to stay safe, stay healthy, and stay home to combat this crisis in our community. Matua's will be back to serve you with the very best local food as soon as the quarantine is lifted. Thank you, Guam. Be safe and please stay home from all of us here at Matua's Bar and Grill, home of authentic Chamorro cuisine.
Maybe it's the perfume drifting through the air, but your head's been out of control. Perhaps it's just the season, that could be the reason you've never wanted her more. Maybe it's the sky reflecting in her eyes, or maybe it's a bottle of wine. It could have been a kiss, I wonder what it is, what's got you feeling so fine. On the cha-cha-cha, blame it on the moon. You can say it's just this magic night. Don't blame it on this tune. Go on, tell me it's this out of the world. You can blame it on a thing or love. It's not the band singing na-na-na. So don't blame it on the cha-cha.
Flood Gun Friday as the rain starts to fall here in Harmon.
Oh, yeah, it is raining.
Yeah, kind of a curveball. It's been so hot the last couple weeks.
Hopefully people will stay home, take this seriously.
Right, yeah, definitely stay home, heed the advice of the governor and, of course, everybody else who's telling you to stay home. And we're wondering now if there's going to be a ramping up of enforcement. I think there needs to be in light of these. We're not, I think it's too early to see if we're flattening the curve. Remember, we weren't testing a lot of people, so it's not. I'm not clear if this is catch up, and that's why we're seeing a lot of positives. So you got to do your part. You got to stay home.
That's right. And also, we just do have some information. We just got it from Guam Power Authority. The Public Utilities Commission recently, or I think last night, approved proposal. I think the downward adjustment of the LEAC, and we have the chairman of the CCU, Simon Sanchez, on the phone. Simon, are you there?
Good morning, Simon.
Yep, former chairman.
Former chairman. Is it Joey Duenas now as the chairman?
I'm just a member, a lowly member.
It's a rank and file lowly member.
We're just a lowly media here, too.
Yeah,
so.
yeah. Well, it's good to hear you on the radio. Been enjoying your show, and it's a lot better than seeing you guys leave at 5:30 in the morning from the gym after you run 700 miles.
Right, yeah.
We're missing good about that.
We're missing the gym, though.
Yeah, we are.
I ran on the beach yesterday. I'm telling you, Epal Beach, it's not hard for me to stay 6 feet away from people because I'm not very fast. But running on the beach in the morning and in the evening and then jumping in the waters it's quite good, and I'm glad you're pointing out the rain. God needs to water the plants. It's a little dry, but and so with the dry season comes, warmer weather, and your aircon has to work a little harder. But the good news is the PUC last night voted, as malfunction might say, unanimously, 5-0 to lower the power bill. They accepted GPA's rate proposal to lower it by 10.4% on meters read after April 1st. So the power you're using now, right, we read your meter starting next week, is now going to be cheaper for the average residential account, about 10.4%. So that'll kind of help you deal with the warmer weather of the dry season. But good news for everybody, because it's there's one thing about not paying your bill or deferring your bill, but we need the bill to be lower too, and that's a big step. And actually, I also want to thank all the ratepayers. We opened up drive-through payments last Saturday up in the Upper Tuma. We had almost 300 people last Saturday pay $80,000 on their bill. So people appreciate also that, if your hours are tough and cut, if you can pay some of it, you don't want it to build up, because we're not going to disconnect anything. That also was decided at the CCU meeting on Tuesday. No disconnections through the end of April, and people are going to run up a tab. We know that.
Yeah.
We're going to work with them to pay off that tab over time. We talked about 8 months, 10 months, maybe even 12 months to catch up. This is not punitive. It's nobody's fault. We've got to work together. People are in some very difficult times, and there's no income, whether you're an individual at work or a business trying to pay. We're seeing our weekly revenues fall almost 93%. Now,
right.
We do a lot of tourism, and we do some military, but we're not alone. We're hearing major hotels are not booking anybody for April.
Right. So if we could just rewind and go back to that, because I think some of our listeners were maybe a little confused, and that the governor had come out and said with the team announcement that you guys were going to defer payments, and then so I think people were kind of thinking that, and then it came out that you're accepting payments through drive-through. But I just want to go back. So just on the record, no disconnections through the end of April. Is that
that
what
was approved?
Correct. That's both John Beneventi and Miguel announced that, and we discussed that at the CCU meeting on Tuesday, and they agreed to extend it beyond March 30th to April 30th. No one's going to get disconnected. We're going to keep power and water going. We'll figure this out on the back end. Pay if you can. If you can't, you're not going to get disconnected. Just conserve your energy use as much as possible, because that bill does come sooner or later. Right. But we're going to give people plenty of time to deal with it. Both companies are strong financially. We're investment grade. We keep reserves on behalf of ratepayers for exactly these circumstances, when you don't have income coming in because your ratepayers are unable to pay due to these kinds of circumstances. So your power's going to flow. We have plenty of oil. It's cheaper for you. Conserve as you must and as you can, but no one should feel that if they absolutely cannot pay their power or water bill, don't fear that your service is going to be cut. And
then what you were saying about payment plan options, how far are we going to be able to stretch some of these payments? Because like you said, when we return to some sense of normalcy, I mean, people are going to be looking at, I'm assuming, over $1,000 in utility bills.
Well, not just utility bills, all the other bills that they can't pay. So all of us that rely on regular payments, whether it's a car payment, a bank payment, or a utility payment, all of us on that side of the equation have to expect a challenge for our customers. And so we're going to have to work with them. We're going to get through this. We're going to be around for a long time, and if we have to work with our customers. We didn't pick a date yet. I think, Chris, part of it is like, what is post-typhoon recovery? Well, you don't know until the typhoon has finally passed.
Right.
Mm-hmm. Kind of. But we'll let you know every day. Once we have that, we'll get a feel for it. But right now, there's 6-month payment plans. But as I thought it through, I can envision that there could be a 12-month payment plan. Because it's just so unusual, and the most unusual is your customers have no income,
right?
And that through no fault of their own. So what does it do good to us to disconnect somebody during this time? This is the time to keep it flowing. We'll sort it out on the back end. People at Guam aren't going anywhere. The Guam Power Authority aren't going anywhere. The Guam Water Works Authority isn't going anywhere. We'll work together. As soon as we have a better handle on it, we'll reach out to you in the media and let you know. But right now, everyone is saying keep keep it going for our community. We'll sort this out, and so that everyone can get through it together.
So again, the LEAC downward adjustment approved 10.7%. What is that?
10.4% on the total bill. So,
right.
And the LEAC went down 18, which translates to a 10. I'd rather just say people are always interested. What's their total bill?
Yeah.
Total bill is about 10.5% for the residential accounts. Business and government will see a very similar decrease, maybe not as big, but the residential account, which is most of our people, they're going to see the biggest cut, and that's going to stay in place. And I think the PUC order said, let's look at it again next month. And so we're going to look at it every month. And if it keeps falling, we'll keep passing it on.
All right. Any final comments?
No, just have a safe weekend. Try to get outside into Guam's beautiful weather if you can for a little bit exercise.
Right. Well, you can go ahead and run a couple miles for us, Simon, if you feel the need to.
I expect to see you out there. But stay healthy as you are doing, and Bree, and as best you can. I have my little routine. I'm about to do it now on my balcony.
Yeah.
But yeah, stay healthy and don't worry about the power bill, and continue to conserve. And we're happy to report that at least the power bill is going to be going down for everybody.
Well, there you go.
And thanks to the GPA employees that are out there working these the drive-through counter
and the generators, the generators, and all those people, and still climbing poles when people say something happened. So those are the other unsung heroes that you're championing. A lot of people are heroes, right? Keeping this island going while we fight this dreaded disease. But we're going to win. And thanks for getting all the information out and keeping our elected folks like us accountable and communicating on their behalf. Really appreciate it.
All right, there you go. Simon Sanchez.
Thanks, Simon.
From the CCU there. Some good news.
Yeah, 10.7% on your power bill, roughly for residential customers. That equates to about $25, I believe.
Right, and I just really wanted to get the clarification on the disconnections because we've been getting a lot of concerns and comments, and like I said, people weren't sure with the governor, then the deferment, because she doesn't have the authority to tell the CCU what to do. They're kind of doing their own thing, and so that's why I wasn't really clear on. Hey, did the Gov send them a memo or something, or what was the deal? So according to Simon, again, no disconnections through the end of April, April 30th. He reiterated, don't worry about it, and they're looking at stretching payment plans in the recovery mode up to 12 months. So.
And again, no one will be disconnected. So that's one of the things you don't have to worry about.
Okay, but if you are disconnected, you please let us know.
Yeah, 637-0094. Email Sabrina@KUAM.com.
Right. So 7:23. Did we want to? Is there anything else from the JIC, or is there anything new with the? Can we just kind of go over this Theodore Roosevelt thing again?
Yeah, I think we should actually play that soundbite that we have from the Pentagon briefing.
Okay, so yeah.
With, the acting Navy commander. So as we reported, the USS Theodore Roosevelt is pulled into port. We heard that from a press briefing that was held overnight sometime from the Pentagon. The Navy aircraft carrier, the U.S. Theodore Roosevelt, is being sidelined after several members of the crew tested positive for the coronavirus. So we're still waiting for definitive numbers. We don't have that, but multiple media, national media, are reporting that more than 20 have tested positive for the coronavirus. The decision was made that the ship was going to be pulling into port, although the U.S. Pacific Fleet is commenting that the USS Theodore Roosevelt had already planned to pull into Guam for a port visit even before the COVID-19 outbreak began on the ship. And the USS Theodore was actually on Guam in February. We did that story. Chris interviewed some of the family members at some of the people that were on the ship that are actually from Guam,
right?
Visiting, and 20, right? 20?
About 20 sailors, Sabrina. And then we also had got a response from Adelup on this whole thing, and
we pulled that up.
Right,
it's really brief.
Very brief, and we're gonna play this clip from this Pentagon press conference right here, talking about the COVID carrier. That's the nickname that it's gotten, the USS Theodore Roosevelt.
I also want to give a quick update on the Teddy Roosevelt, which we spoke about the other day. We found several more cases on board the ship. We are in the process now of testing 100% of the crew of that ship to ensure that that we were able to contain whatever spread might have occurred there on the ship. And but I also want to emphasize that the ship is operationally capable and can do its mission if required to do so. So the ship is pulling into Guam. It will be pierside. No one on the crew will be allowed to leave anywhere into Guam other than on pierside. And we are already starting the process of testing 100% of the crew to ensure that we've got that contained. The sailors who have been flown off the ship are currently doing fine. None of them have been required to be hospitalized because their symptoms are very mild. They're aches and pains and those types of things, sore throats, but nothing that required hospitalization. So they're in quarantine now on Guam.
Navy Thomas Modly talking with media during a press conference at the Pentagon. He indicated that the ship is on its way to Guam, but we've learned that it is actually here. The governor issued a statement. Really briefly, please defer your questions to Rear Admiral Manoni. We can confirm that all sailors will be quarantined on the ship and on naval base. And as you heard from Modly, the acting secretary of the Navy, that the sailors will remain on the ship in pierside. They won't be venturing into the community, so please, everyone, don't panic. They're not going to be out, mingling. They're all going to be quarantined, but they are going to conduct testing, 100% testing of every single sailor on board that ship, and that's more than 5,000 sailors.
So I'm just kind of thinking, as a local who doesn't have base access, like here we are trying to shake down the world's tree for COVID-19 test kits, and then you find out, like, just a stone's throw over a fence on the same island, they have the capability to test 5,000 people. That's kind of hard for me to stomach.
Mm-hmm.
And I think the governor, who is touting her close relationship with Admiral Manoni, every chance she gets, I think she needs to make the ask, hey, see now, just give us a couple of 300, 400 tests,
You're making much more.
Come on. It's mess tomorrow on me and FMaulik. So I don't know. We'll see. But I really expect more from was that even 2 sentences or was it just one from Adelu?
It was 2.
Okay, 2 sentences. I kind of feel like if I'm the governor, maybe I might throw in how I feel about this. I don't know. It's 7:28. Let's get from the Guam Hotel and Restaurant Association, Mary Rhodes onto the show. Good morning, Mary.
Hi, good morning.
Well, it's Friday, and you sound chipper as always. I know that you've got a lot of things going on with the GHRA.
Yes.
And
they're always including us.
Yeah, and I'm not sure where we're gonna start here. Did we want to do this Guam Reef Hotel thing? It was brought up a couple of days ago in a press conference. The governor didn't know about it, but it turns out that there is a small group of this 506 Squadron that's on a self quarantine, similar to other people who come into Guam. You want to kind of clarify that for us?
Sure. At any time, we do have military active personnel, but also Department of Defense civilian workers who fly into Guam through Honolulu or other routes. And when they come into Guam, they are still subject to the mandatory quarantine as of last week, Thursday. So this is no different from any of our residents or tourists who fly in and are subject to this. The one difference here, though, is that they are on restricted movement, and Anderson Air Force Base is working to ensure that they go straight from hotel to work, only because they are mission critical, but they are part of a deployed group of 150 people that have been staying at Guam Reef for 2 years. So it's important for everybody to understand that this is not related to the USS Roosevelt, and that at any one time, we actually have 13 hotels who are contracted with the military. So we have several hundreds, sometimes thousands at the hotels in short-term and long-term lodging.
Mm-hmm. Have you been part of the discussions for this economic relief plan that the governor's been discussing? And I know that the GITA Deputy Director, Ricky Hernandez, he made a brief presentation during the media conference yesterday.
Yes, I've been part of 2 conversations so far, or groups. One was the Team Guam, where she presented her initial plan to the different business groups, and then the one where Ricky made a presentation. So yes, I've been part of both of those.
And what do you think of the plan there from Ricky Hernandez and the governor's fiscal strike team?
Well, just so you know, that's not the only thing being discussed. She is reaching out to specific business people so that we can also provide input on additional ideas of where we can add some, not just some strategic planning, but also some recommendations of what things we can offer. So it is a two-way communication, which I think is good, especially right now. I think that the more people who give input, and I think that she is open to it, especially now that we're on an extension. But, you know, I even serve on the GVB task force for the coronavirus, and we provide a lot of economic forecasting information based on what we see in the next several months. And so I think that's going to be really important to tie all of those in.
Can you just tell us what is the economic forecast for the next several months?
Well, with the extension already, we were expected to be at 30%, and with this new extension and with flights already suspending services through April, it's probably it's gone from 30% down to almost zero arrivals. And so obviously everybody's adjusting their numbers, and businesses, you will start hearing some businesses just temporarily close in the next couple weeks because there's no reason to operate unless they have the military or short, long-term tourists staying in the hotels or even residents. There are some hotels who have zero traffic coming in at all because they're not part of the military contracts and they have not been receiving any tourists. So I've already been notified by several that there are plans to temporarily shut down. I do know that there are 2 hotels looking at even closing doors permanently.
Can you tell us which hotels those are? Is one of them Verona?
Well, they've been closed for, I don't know if you consider that really open. But yes, I do know that I've already been notified by Royal Orchid that they've closed a while ago. And so they are not looking to reopen at this time. I'm not sure if they're going to be selling, but they've confirmed that with me. And then also Holiday Resort in JMSH, which operates Garden Villa, they have also indicated that they won't, they're right now reconsidering that. So between those hotels, you know, that's very key when you're having businesses already reconsider their entire operation.
Right. Mary, what can you tell us about layoffs? We haven't yet got any numbers about that, and you know, just from the GHRA side.
Sure. We've been polling our group since January of what their plans are, but really heavily in the last 2 weeks, and we've actually shared some information. I know you were able to finally speak to Dave De La Sola, and we have shared some initial information. And our numbers, the industry does employ 20,000 people. We do make up 35% of the population. And at this time, our initial estimates are around 3,000 people have been affected with their jobs, whether it's reduction in hours, reduction in force or furloughs, and layoffs. So it's a mix of those. And I can't release the specific data because we're still collecting it and reporting it into DOL. We've already offered long time ago to be their partner for private sector to help navigate through the programs and share this with our membership. So right now it's about 3,000 people have been affected by this, but it's a mix of things, not all layoffs and furloughs.
Mary, how is the working relationship with you and the local Department of Labor and David De La Sola in terms of getting any answers or any type of assistance for these employees who have been affected by COVID-19?
I think that it's good in the fact that we do share information, and there are plans to work to provide these services. I did share with the Gov that I know she's very concerned about the public health. That is her number one priority, and she cannot reopen Guam Department of Labor or any of the other agencies. But I think it is important to have like a small go team, if you will, even working remotely, so that we could start sharing information at least electronically via email. But we're doing that on our part. I have one person who is focusing just on this with the employer groups and walking them through the DOL website. and understanding some of the Workforce Investment Opportunities Act federal funding that's available today, but also starting the conversations about, as soon as the administrative protocols are set for the federal funds that just got approved with the Senate and Congress, then we'll make that information available as soon as it's ready for digestion from DOL, but also GITA. And that was something Ricky did talk about yesterday, was they are currently trying to understand the different administrative protocols of how to get that federal funding for businesses, and also to apply the different benefits like sick leave and things like that. So we're still waiting for direction, but in the meantime, we can at least educate our members while they're making decisions today. We can't wait for GovGuam to reopen, but we can certainly help provide guidance. And that's what's really key right now, is providing information to our membership, and not necessarily to the employees at this time, because that's really the role of DOL, but at least to the employer groups on how to make, when they're making their decisions, what do you need to do to keep individuals on the payroll, but you can still do some things where they still have access to health insurance through COBRA. They still are at least legally defined in how they were going to be reduced in the fact that they will be eligible for federal benefits.
Mary, I wanted to ask and follow up on something that I watched during one of the Pentagon press briefings, when it was mentioned that the Army Corps of Engineers are going to be deployed and assisting in several parts of the country to convert hotels into, I guess, like mini hospital facilities, or even quarantine and isolation facilities. Have you received any information on that, whether that's going to happen locally?
I have not. I know that probably in the case of, with regards to our buildings right now, I think that GHRA has really stepped up in working with the government of Guam, and we do have a direct contact where not just hotels, but also other types of facilities have been considered. And we started this process about a month ago. And so we've been able to successfully include some of these facilities to serve as not just mandatory quarantine for our Manila travelers, but also auxiliary hotels to provide self-quarantine for other types of travelers, or even residents. So I think that for quarantine facilities, we've been able to assist the government in providing alternative solutions instead of what the pandemic plan called for, which was the Dededo Sports Complex and UOG Fieldhouse. So I think we met our goal there, and they're still always looking for additional quarantine facilities. But then the second piece about converting rooms, I think it's important to note that the skilled nursing facility has capacity of, I believe, 58, and only 2 are there currently.
Right.
GMH has people there. The skilled nursing facility still has a lot of capacity. So I don't think we're there yet, but my concern is inside the fence with regards to the USS Roosevelt. They're going to have to convert some places inside the fence, and I think that would be their highest priority if the Army Corps of Engineers or the Seabees or whoever is on island, where that is their critical mission.
Mm-hmm. I wanted to follow up also on something that Linda and Bingo DeNorsi mentioned regarding an isolation facility at a hotel. Can you tell us anything about that?
The isolation facility right now, the way it's supposed to serve is similar to skilled nursing facilities, but the difference is that they are positive, but that their symptoms are mild. So instead of quarantining at home or isolating at home, because they don't want to run the risk of, because they are positive, they're not a PUI, person under investigation, they are positive, they need to be careful because they can't necessarily stay home, especially with elderly or now I guess anybody, because it doesn't matter. Our numbers aren't showing a higher percentage to just elderly. It's actually spread across the board. So there's been a need to not just have quarantine facilities, but also an isolation facility, just because of our dense areas in some villages, but also just you don't want to run the risk of having more positives out in the community.
Right. And so wherever this isolation facility, hotel, what efforts are underway to ensure that the employees that work there are protected from exposure?
We have been very clear from the beginning that we want little to almost no exposure. If the government of Guam, through their mandate, is going to have access to the facility, everything that we've been stressing is that the government either takes over the building and still has certain things functioning, like engineering, back of the house operations for maintenance of the building, but little to no access with front desk and housekeeping. But as we've gone through this the last week and a half in quarantine, it is pretty clear that, you know, we need to still provide some back of the house operations and support services, because at this time there's only so many resources that we have. But I think it's been helpful that GPD has been augmented now with the National Guard, but and that public health, they have a really core team that they've been working with, and they've been really great in coordinating services with the hotels in making sure that public health is taking the lead on any front of the house services. So I think that has improved as we've all been kind of learning through this. I think that public health has done a great job in trying to close the gaps on some of the things initially that we've been going through.
Just an update. So there's still 3 quarantine facilities, is that correct? Hotels?
There's a fourth one.
Is the fourth one the isolation facility, or 4 quarantine facilities and 1 isolation facility?
I believe, I can't really comment to that because they are under contract negotiations, and we are not releasing where these are. I know that there's been some coverage on where these locations are at, but that's going to have to come from legal counsel with the government. But I can say that though we did add a 4th and a larger one, so that way the government has some room to move around should they need to create more isolation facilities.
So, isolation or quarantine?
Both.
Okay, so 4 quarantine, 1 isolation? Because when we talked to Linda, she mentioned there were 3 quarantine facilities and then 1 isolation facility.
Right. So basically, we've converted one into. We've consolidated people into a quarantine facility.
Okay.
And one of the smaller ones has become
the isolation
facility.
Okay.
Correct.
Right.
Similar, but in a lesser capacity than skilled nursing facility, because obviously they don't have all the medical equipment there. But the plan is to get it up to that level.
Yeah. Yeah. So it's not stood up yet?
No.
Okay.
There's a whole process when we've had people in it, like with decontamination and things like that. So there's a whole process. So just know that the government of Guam is working closely with these facilities to ensure that they are having a walkthrough with public health, and CDC is reviewing what their capabilities are and which ones are ideal for these kinds of locations. And it's not like we're there yet, again, because we do have the skilled nursing facility available that's not at full capacity. So therefore, we're just really preparing based on what they've seen in the community. The governor is very concerned with the numbers that we've been seeing as tests increase. So we're just really making sure that we provide all the necessary rooms available and convert those rooms to what is needed.
Are you guys getting, or the hotels, I mean, I hope this isn't a stupid question, but are they getting paid for this? Is this,
Yes, they are under contract negotiations and agreements are in place, and part of the funding is for lodging and meals is through the federal dollars. So the governor, I believe, has spoken to that before. So these are contracted services, just like just so you know, like all of the linens are outsourced. The hotels don't have linen services anymore. That went away more than 10, 15 years ago. So they've thought through all of those moving parts and have contracted with facilities. The one thing that the hotels or other types of facilities have provided as part of their contract is meals. So, because I've gotten requests from other types of businesses like restaurants in providing those meals, but it's something that the hotels or facilities are including because it's another way to help contain contact, right?
Right.
So it's important that it's all part of the same process and comes from the same source.
Right.
And one other thing before we let you go, because I know that the hotel industry, they're experiencing a lot, but they're also giving back as well. And and I read, I get your updates that you send, and there's several different hotels, right, that have stepped up.
Oh my
and
gosh!
provided
I just
donations.
gave the update, and initially GMH asked for 12,000 units of shower caps and amenities and all that. I just provided that report into GBB and through our response committee, our RAC at EOC, and we're currently calculating it because I got the update last night. But I have more than 10 hotels who have donated shower caps, amenities, but also gloves and other types of things. And so we're well above. I want to say we doubled the number of units that GMH needed. But also, it's not just to GMH. I've seen some donations go to the Mayor's Council for elderly in the community, but also the ones who have quarantine hotels have created care packages with inspiring notes for those in quarantine as well.
Send us some pictures of that stuff, Mary, if you can.
Sure. We're going to be releasing that with GHRA, and so we'll send that out to you as long as I'm just working on getting permissions for releasing that on the photo themselves.
Yeah.
But thank you for mentioning that, Sabrina, because I think, even though they are challenging times, I think that the industry themselves, just like other businesses, have really stepped up, but not just the hotels, but also restaurants. Restaurants have, I don't know if you saw what Lenny at Kadu did recently, but there's a lot of restaurants who have stepped up and really even distributors have gone out and started donating some things. But, as much as donations are good for our community, so is the level of support back to the businesses. And so I'm really, as much as we want to mitigate like any community access and tell people to stay home, there are still delivery services available from these restaurants. So we've been trying to send out the positive messages as well. So thanks for bringing that up, Sabrina.
All right. Well, thank you, Mary. I know you're working really hard.
Man, you are a hustler.
Goodness.
Wow.
Oh, you have no idea.
We have an idea.
But there's a lot. And, that's why GHRA was created, is to serve as that intermediary liaison with Government of Guam. And so I personally have been at the EOC RAC for 14 years, but GHRA has been part of that whole process. So I just want to remind everybody that, we are here for you. We're here to kind of help navigate you through this because we want businesses and employees of the industry to remain strong during this process and have a long-term plan. That's what we're working on next, is that economic measure and long-term plan.
Nice.
So that businesses don't get stuck in where we're at today.
Okay, Mary, we really appreciate it. We'll let you get back to work.
Thank
and
you, guys.
You send some
Take
pictures
care.
over, okay?
Be safe.
All right.
Okay, bye. Mary Rhodes from the Guam Hotel Restaurant Association. Can we just run through that JIC release, and I'll get a couple people on the phone here?
Okay, I'll run through it in just a second. I just wanted to point out some of the things that she did issue in one of her updates, that several hotels have donated shower caps to the Guam Memorial Hospital. I received pictures from Westin Resort. They donated thousands to GMH as well as to the Mayor's Council of Guam. Many restaurants have donated food and changed operations for takeout, delivery, and drive-through services. United Airlines, they've also donated more than 100 advanced emergency kit supplies, such as blood pressure cuffs, stethoscopes, and artificial manual breathing unit bags. Visitor safety officers, they continue to patrol Tumon, acting as a crime deterrent and reminding the public of the governor's mandates with social distancing and the closure of public parks and beaches. So kudos to all of these hotels and all of these other service industries that are stepping up and helping our community.
Right, and let's go over to the University of Guam right now with Dr. Anita Borja Enriquez. Good morning, Doc.
Good morning. How's the day?
Thanks for joining us. We just wanted to get you on real quick. A lot of University of Guam students chiming in on the comments, and we're really making the move over to full online. Is that what's going on?
Yes, Chris. I mean, our strategic intent is to ensure that we take care of our students, and recognizing that we've only gone through half of our semester and wanted to provide reassurances that we'll get them through to completion of the semester.
And can you tell us, because I saw in the statement from Jonas that there's going to be some full online and there's going to be some other classes that are just doing other things to move away from face-to-face instruction, right? So how are they getting creative with in the ways that they're giving the students the workload?
Sure. I mean, a number of faculty have already been teaching online courses since the start of the semester. Of the 900 plus course sections that we have, 300 of those course sections have already had regular contact between faculty and students on Moodle and other support that's been provided by our Office of Information Technology. We recognize that, in terms of the state of readiness of our faculty and of our students, that already half of our faculty have been trained on the Moodle learning system, and we recognize as well that most of our students have been familiar with this modality. It's just a matter of doing an assessment of how many of our students have access to the equipment and to internet at their home in order to ensure that they can navigate through the online training that's already been prepared for them. So we've been heartened to see just the amount of commitment and the resiliency of our faculty moving forward. Of course, at varied levels of preparedness, and some have already kicked in since last week. So we're monitoring that. We're providing as much of the technical support from our Telecommunications and Distance Education Office, which is part of the Office of Information Technology. We do have some tutorials that have already been posted and live training that is scheduled all of next week, part of our effort to take our students through what we call a virtual field trip to navigate through these different types of online support platforms.
Okay, so this begins April 6th, you said?
I'm sorry?
The full online classes?
Full online classes. Well, we've got a third of our course sections are either fully online or on a hybrid mode.
Right.
Sorry. So that's about 300.
Anita, let's talk about motivation. How many students are just not feeling it? I mean, I'm sorry, we're going through this social isolation, and people are dragging. Are there going to be any allowances, or is it just like, suck it up, buttercup, do your homework?
No, there are obviously a lot of anxieties across, all of our households, including our first responders and our nursing faculty who've been activated to support, the crises and our island's needs. Of the feedback that we've been getting through our deans, I've asked the deans to assess the level of readiness to have the faculty as well survey their students and to be in a regular communication between the faculty and the students using whatever means they've already set up, whether it be through their WhatsApp group chat or email. But we're finding that based on the feedback that I've received through the deans, that a number of students are, yes, we've got the tools, yes, we've got the internet, yes, we're just waiting for more instruction. So it's we're talking about very dire times, very unprecedented challenges that we're facing, and certainly for everyone involved, faculty and students through uncharted waters.
Right. And this is another issue that's happening all across the country with
Yeah.
regards to graduation, spring commencement.
Right.
What sort of
Right.
talks are you guys having here at UOG?
Our intent is to graduate the students. We're reaching out to all the graduating seniors to give them reassurances. What we did say as well is that they will graduate with the credentials, provided they meet their course and other outstanding requirements for the degree. And the commencement ceremony itself will be postponed, and we're looking at a future day sometime this coming fall, if not mid, then perhaps the latter part of the fall or Whanasan 2020 semester.
All right. Any other? Oh, no, I did want to ask, was there anything about a quarantine facility at the UOG field house? Is there any update on that?
Yeah, well, we did learn that the field house, like gyms and other centers, have been identified. I believe the field house will be one of those last resorts, obviously. And I know that they've talked about the Dedido Sports Complex as one of those options as well. And so we've not heard any more details on that.
Okay. Any final comments?
Yes, I just want to give assurances to our students. All of our staff, our Enrollment Management Student Success Division are on standby. We've sent out another letter to our students on the 25th. We encourage all students to go through your official Triton email account to get email address rather to get more information, and stay tuned to the emails that are flowing from your faculty, because that's where all of the instruction and guidance and support will be coming through. In addition, stay tuned to obviously all of our press releases, our social media avenues to get more information. We are in standby. We're still operating, albeit most of us doing it from a teleworking mode. But major kudos to our faculty for their commitment. Major kudos to our nursing faculty and Dean Margaret Hattori, our Triton hero, who is our Dean of the School of Health, for all the efforts going into the call centers that we've been supporting, and kudos to all of the UOG personnel as well, providing food to those who are stationed at these call centers throughout the island.
All right. Well, thank you. Thank you to you as well.
Thank you very much.
Thank you very much, Anita. Good luck, and wash your hands.
Okay, you too.
Okay, 7:58, KUAM FM, Hagåtña, Guam. We're going to do news, Sabrina, and then we're getting the deputy of the Guam Economic Development Authority, Ricky Hernandez, on the show to talk about some of the economic things that we're working on there.
Yep.
Okay, so good morning. It's Containing COVID on KUAM News.
Buenos and Hafide. Thank you, Chris and Bree, for allowing us to perform today. My name is Eric Borja, and to my left is Mr. Ralph Kileneman, and we are Masaya Hoffa. He's really not to my left because we are actually practicing social distancing, and we're trying to do our part to help flatten the curve. So we encourage everybody out here on the island and around the world to stay home and do your part. And if you need to be out on the road, please be safe. If you need to go to the store and get your food and all that, we ask that you use a mask and use your hand sanitizer if you have any, and Clorox wipes. And also, we want to say, Sudus Masi, para todos si finena na responso, y medicos and y enfermera, para todo matotsogwi para isla, Sudus Masi. This is a song I wrote a long time ago. It's called Sinhagu, and it's dedicated to everybody that you love. And for that love relationship, this one's for you. Thank you. When I first saw you, girl, you put a big smile on my face. Then I said to myself,
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Be healthy. Be informed with ITD. Healthy. Be informed with
Island-wide shutdown. Let's get Ricky Hernandez of the Guam Economic Development Authority. He's the deputy, but he's kind of leading the charge. Good morning, Ricky.
Good morning, Chris.
I know you're kind of leading the charge on a lot of the economic recovery initiatives that are coming out of Adelup, and you did a presentation yesterday. You kind of want to just summarize
us through that, yeah.
Yeah, sure. You know, we at Guam Economic Development Authority, you know, our goal really is to try and coordinate some of this economic activity, especially in terms of the recovery efforts. And what we provided was just kind of a summary. We led everyone to our website at investguam.com/coronavirus, and on that website we had put together a presentation just related to some of the already enacted economic recovery initiatives for not only businesses but some individuals and workers as well. And on that presentation, we kind of just summarized the who, what, where, when, why, and how of some of these. And really, the issues that we're having with some of the federal initiatives is that they just happened. And so, you know, obviously, I'm more of a coordinator than anything, and trying to coordinate some of the local agencies to interact with their, and they're already doing this, but just to kind of coordinate between agencies, to coordinate with their federal counterparts to ensure that whatever is available from an execution side for any of these economic recovery programs and initiatives, that we ensure that there is no delay or the least amount of delay possible to get these out to the business community and our people.
Okay, well, I'm on the website now, and it says federal and local economic recovery initiatives. Can you tell us about that? It says business operations assistance.
Yeah, sure. So this is kind of just a combination of what has been announced already by Governor Leon Guerrero in terms of some of the assistance to businesses in terms of helping their cash flow, like deferring 40% of business privilege taxes for those due in April, May, and June by 90 days per month. The extension of deadline this has already been announced nationally, of moving the filing deadline as well as the tax payment deadline for all income taxes, both individual and corporate. And there are many others. I can go through all of them if you'd like, but if there's any one in particular you'd like to talk about, I could kind of elaborate a little bit more on them.
First, I wanted to ask about who all is involved. Who are the people that are involved with putting this all together? Just Gita and who else? Members of the business community?
Yeah, so the presentation was put together in collaboration with Guam Department of Labor and Department of Revenue and Taxation, because some of the couple of the federal initiatives, more specifically the Emergency Paid Leave Act and then the Emergency Family and Medical Leave Expansion Act, both touch basically those two agencies locally and then their federal counterparts. And so just in terms of trying to operationalize the legalese in federal legislation and how that kind of trickles down into the federal agencies and now how it trickles down into the government agencies, that's where we're trying to navigate. And you probably know well enough too that oftentimes there's a little bit of a nuance to territories, and so how that is kind of communicated and how that is just implemented has to be kind of discussed specifically with Guam and different other territories.
Mm-hmm. Yeah. So what I'm getting at is who all is providing all the advice to the governor on the economic recovery plan, and I'm just wondering if the Chamber of Commerce is involved in any of this.
Oh yes. So the governor has had a couple meetings, I believe, with business organizations, including the Chamber of Commerce, Guam Hotel and Restaurant Association, Chinese Chamber of Commerce, just Women's Chamber of Commerce, and so forth. And the goal really is to try to create a group that could disseminate all of this information broadly, because GITA and the governor's office may not be able to do it on its own. So we need obviously the partners to be able to disseminate information. How do you implement the emergency paid sick leave act? How do you implement that in your business? Because these things require notices that are supposed to be provided to employees in their workplace, and those notices come out from the Secretary of Labor. But how do you get that into businesses? And so what we're trying to do is we're trying to coordinate that so that when employees and employers need to implement this or receive the benefits from it, that information is available.
Mm-hmm. Can you take us through this Family First Coronavirus Response Act, the emergency family?
Yeah, sure. So those two. There's two programs there. There's obviously a lot more in that specific legislation, but these two are kind of specific to how impacting some of our a lot of our businesses. So there were two provisions or two programs under the Families First Coronavirus Response Act, and one of them, first one on our presentation, is the Emergency Family and Medical Leave Act, Expansion Act. And so what that basically is it's mandatory benefits that have to be provided to by employers to their employees if their employees, and obviously there's a lot of definitions of what's an eligible or what's an employer, right? It's supposed to be 500 or less employees. Mm-hmm. There's a lot of questions that we're receiving from the business community on, well, what if I have multiple DBAs? Do I roll them up into my parent company? There's a lot of those questions that are coming in. We're trying to get those answered, which is why it's important to have that group of business organizations so that we can disseminate it through them. But basically, for example, the FMLA, what that does is it requires the employers that are defined as required to implement this to provide leave benefits for their employees for up to 10 weeks after a 2-week period that may be used, they may use their own personal leave, their own sick leave, or if they're eligible for the Paid Sick Leave Act, they could use that. And so the question might be, well, how do these businesses pay for these benefits, and what are the eligibility for some of these employees? I just want to put a disclaimer that we're putting out this information, obviously, as assistance in terms of helping businesses try to understand what they need to do as it relates to the law. But I would urge all of the businesses, obviously, to work with their attorneys, work with their accountants, and work with their HR professionals to ensure how they're implementing it is in accordance with their professional advisors. But obviously, just providing some level of guidance and assistance on our end is what we're trying to do here. And so the way that these businesses are supposed to be paying for this is they would pay their employees these benefits based on the guidance that's provided, and they are eligible for what is considered a payroll tax credit that they can take against whatever they pay in terms of Social Security and Medicare taxes, and that's how they're able to pay for these leave benefits.
Hey, Ricky, so the Chamber of Commerce, of course, has been making a lot of noise about not being folded into these conversations. I know that you and the governor has also mentioned that she has business advisors. So can we get some names? Who's on this? And is the Chamber involved? Because we're going to talk to Christine. Do they get a seat at the table? Because I heard you mention every Chamber organization except for the main one.
Oh, yeah, no. I think in one of our meetings, the Chamber was represented in one of our meetings, at least yesterday.
By who?
It was Christine Bellet.
Okay.
Yeah, and obviously, with all of these things, a seat at the table in terms of all of these federal programs, that's, I think everyone would hope for a seat at the table for that. But
right.
Obviously, we're just trying to implement what is coming down for us, and so in terms of getting guidance and trying to advise the governor. All of that. I mean, there's a lot of people that have access to the governor in terms of just being able to call her because she's very accessible.
Right.
So, in that regard, there's a lot of informal discussion going on, as anyone would be able to have with the governor. But formal items and how to implement things and things like that. What we're trying to really do is really just try to provide the businesses guidance in terms of how what's coming down and how these are going to be implemented locally, and any information that we could get from businesses in their review of certain things is obviously something that we're willing to work with, and everyone there's hundreds of pages of information and reading that could be done, and what there's never enough help that we can get, right? And so any of the business community, any questions they may have that we may not have thought about, obviously we're taking those in and we're trying to direct it to the federal counterparts that do have the answers. And a lot of times, as an example, Families First Coronavirus Response Act, that just came down about a week ago, and federal agencies are still, the information is still trickling down.
Right, yeah.
Yeah, there's a lot of questions that need to be answered, but a lot of those questions that have been answered, we are trying to update our website and include that there. But also, obviously, we're working very closely with Dave Delasola at Guam Department of Labor and Daphne Shimizu at Department of Revenue and Taxation to, just to coordinate. And they're just kind of leaning on Gita to get out to the business community, but obviously the business community calls them directly as well. So, we're all hands on deck in terms of trying to ensure that all of these initiatives are carried out as expeditiously as possible.
All right. Well, thank you so much, Ricky, for all the information that you provided. Again, the website, Invest Guam, right? Invest Guam /coronavirus.
Gita's website is investguam.com/coronavirus. And we have links to all of the coronavirus, well, we tried to find all of them, but all of the coronavirus-related local websites as well. So there's public health, revenue and taxation. And so you can check our website. We update all the JICs as they come in and all of the short-form JICs images that come in. And so we're trying to keep that up to date. And any of the guidance that comes down, we'll be posting that on our website as well. We just got some guidance from Dave. Just sent some guidance regarding these leave benefits that are in the Families First Act. So
right.
I'm going to be posting that today.
Right, and so Ricky, a lot of maybe the delay is waiting for, like you said, these federal agencies to figure this out, because I mean we can't figure it out until they do, right?
Yeah, and I'm not saying that any of the federal agencies are,
No, I mean because it's all new. It's all new. I mean this.
Yeah.
Rapidly evolving.
Yes, and they're whatever the government needs to provide to the federal agencies, that's what we're working on as well. So that's kind of if they need information from the government of Guam, obviously we'll be coordinating to ensure that information is provided so that there's no lag or stall in implementing any of these initiatives.
Right on. Hey, thank you, Ricky.
Okay, no problem.
Keep you safe.
Definitely appreciate it. Deputy Director of the Guam Economic Development Authority, Ricky Hernandez, with it sounds like they're kind of just getting started on this. What Mary Rhodes had said, I was thinking about that, was recovery doesn't really start until the end of what you're trying to recover from.
They're planning now, and they're providing whatever information they have to the community, and on their website. That website again is investguam.com/coronavirus. And
right.
hopefully we can get Dave Delasola maybe next week when things start to settle a little bit with all the the relief package that's still before Congress, I think. And he can help sort all of that out for us.
I wanted to address, there was a comment here on our Facebook Live. Thank you guys so much for your comments. And we do try to read all the comments. Obviously, it's pretty impossible. But, I feel like we have a good idea of what you guys want to know. And Nora had commented in here, kind of upset, a lot of exclamation points. But she was saying, oh, you guys aren't answering our questions. And I said, well, what are your questions? And we've answered all these questions. But again, if you're listening, you're just jumping in, I think it's key to share the Facebook Live, because we come out of the gate at 6 o'clock just running. We're just going. So if you don't tune in at 6, you're missing so much. So share the broadcast. When we're done live, watch it from the beginning, because we are really trying to answer every question that you guys post and every question that we feel the people of Guam need to know the answer to. So she writes, how confident is the governor with the home isolation? ! Well, again, according to the CDC guidelines, the home isolation is okay. Are we worried about it? Hell yes, we're worried about it. I mean, we are definitely worried about it, and there is a high if they're not being checked on, and if we're just leaving it on these people on home isolation, there's a chance they're going to infect people.
And also for people who do have questions, want to know what's happening, there is a phone number to call, and that is 475-9473, 475-9473, or 475-4770. That is the number that was provided by the Joint Information Center for people out there in the community that have any questions. That's the numbers that you need to call, because obviously we're not in charge of the recovery plans and all of that.
Right,
and,
but we're getting all the info, and I got a pretty good short-term memory, so I'm remembering a lot of this stuff. She also writes, what protection does she see happening for the confirmed COVID-19 patient's family and the public? And again, according to the CDC guidelines, which is what they kind of hold up, if they follow the home isolation and the self-quarantine protocols, it should minimize the risk to the family and the public. And why couldn't she isolate them in a hotel like she's doing for those passengers who she doesn't know if they have the virus or not?
This is for the COVID-19 positive patients.
Right. Yeah.
Well, they're on home isolation.
Yeah, they are in home isolation, but again,
supposedly monitored by the Department of Public Health
through phone calls. I hear they get called a couple times a day. Nora, I feel your worries. I have the same worries as you, girl. Like I don't think who listens to their doctor, really? Unfortunately, we don't. I mean, I went to the doctor last year and he was like, do this, do that, and I'm only doing like 2 of the things. So we're sending these patients home. They're COVID-19 positive. They're being told what they have to do to help avoid the spread of COVID-19, and then it's on them. Do I agree with that? No, I don't. I think they should, we should be taking more stringent measures, but again...
But, I think Linda DeNorsi, when we interviewed her a couple of days ago, she said that, they can't really force them. They're trying to get them to volunteer to go to the isolation facilities. But you heard from Mary Rose, it's not yet stood up.
Right.
So they're still outfitting the hotel, this designated hotel,
right,
to be able to accept these home isolation COVID positive patients.
Right, and we're on day 12. I'm not making excuses for anybody. That's not my job, but the whole world is doing this. And hey, 637-0094. We're going to take a break real quick. Bree, I wanted to get Christine from the Guam Chamber of Commerce and kind of get their reaction to what the governor's got going on economically. We are, focusing on the economy right now, but there's just so much going on with this USS Theodore Roosevelt. I just got a message on WhatsApp from one of my friends, Willie, who writes, "Did you hear that the aircraft carrier docked here on Guam?" Yeah, Willie, welcome to the program.
Good morning.
Yeah, that's the news, is the COVID carrier, the USS Theodore Roosevelt, is docked on Guam. And I'm already getting so many different messages, Bree. People are worried about what's happening with the COVID-19 positives on the Roosevelt.
They're all going to be staying on the ship or pier. They won't be allowed out into the community. They're going to be pierside, and that's about it. All 5,500 are going to be tested.
Unless they're in need of hospitalization, and in the event they are in need of hospitalization, they are supposed to go to United States Naval Hospital.
Right, in Agana Heights.
Right, and so we know...
Were medevac there from the ship.
4 were, yeah.
And they went to Naval Hospital, and they're on isolation.
Right, and so what's happening in that rapidly developing situation is there are now more than 20 sailors aboard the Theodore Roosevelt.
Multiple media, national media are reporting that. We are trying to get some kind of confirmation from Joint Region Marianas on just how many have actually tested positive. Because if they do and they're taken to Naval Hospital, that by law has to be reported to the Department of Public Health.
Right.
And we haven't heard anything yet from them.
We haven't. They made us call Hawaii, basically.
Right, U.S. Pacific Fleet, and they even in their release they said that they already planned to
right,
pull into port before the coronavirus outbreak, and the same ship was here in February.
It was, and so you guys, there's resources out there. There's ways to get information. Bree, I gotta give you props, man, because we didn't get anything from the governor. I mean, it was clear she knew that this was going to happen. It was clear that, she was in contact with Admiral Manoni. And then for whatever reason, maybe she felt that it was confident, top secret, and she wasn't allowed to tell us.
Yeah, you're probably not allowed to share the information. I don't know.
But I don't know. I feel like, the governor's responsibility is to inform the people of Guam with. We should know what she knows. That being said, one of the things I thought was interesting is not the right word, but the Pentagon in a press conference said they're going to test all 5,000 sailors aboard the Theodore Roosevelt.
100% testing.
Yeah, so they're going to get 5,000 tests, and we've got like about 100, I think, after last night. Yeah.
So the governor did put in an immediate request for 1,000 test kits. It was a couple days ago.
Yeah, and so I know that they're trying to figure out where in the supply chain we can get the tests quicker.
And there's supposed, a national shortage of these test kits.
All right, so let's take a break. It's 8:26, containing COVID. Good morning, Guam.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Be healthy. Be informed with ITD. healthy. Be informed.
Reporting for Guam's News Network, I'm Jonagan Charfris.
KUAM News Updates are brought to you by McDonald's of Guam. I'm loving it.
Killcliff makes performance drinks for warriors, people out there killing it every day. The better alternative to traditional sports drinks, energy drinks, and soda. Killcliff has expanded into a complete performance system to help you before, during, and after a tough workout, long days, or just when you need to get back to full speed. Killcliff Ignite, Endure, and Recover offer a complete beverage solution that meets pre, during, and post-workout needs for athletes of all ages, missions, and levels. Better fuel, better recovery, better training. Killcliff may be purchased at Custom Fitness, Shell Foodies Guam, Health City Guam, The Boca Box, CrossFit Laddystone, CS Coffee Shop, Onadera Store, The Bridge Fitness Guam, and Circle K 76.
Oh, what's for breakfast at KFC under $3.95, you ask? What's for breakfast at KFC that's different than the other guys, you ask? KFC's chicken wrap, sausage wrap, the Colonel's chicken congee, chicken fried steak, sausage biscuit and gravy, and biscuit sandwiches made with KFC's original fluffy biscuits. All for under $3.95 and all only at KFC. Plus, with waffles and the Colonel's chicken fried rice, we've got something for everyone.
So visit KFC for breakfast today. It's finger licking good.
Every hour during the month of March, I-94 FM will play Chamorro song in honor of Mesh Chamorro. Every hour is an opportunity to honor the trailblazers and visionaries within the Chamorro music. Content Chamorro, Para y Hora, is presented to you by Matua's Bar and Grill, home of authentic Chamorro cuisines. Call 969-6184.
Dear people who haven't had a Big Mac, who saw millions of people enjoying something and said, no thanks. We're not giving up on you, because today is a new day. A day for a burger that has a bun in the middle because it can. A day for a sauce so special they put it on there twice. A day for McDonald's most McDonald's burger. So go, because today's your day for a Big Mac.
Now available in 3 sizes, including the new Little Mac and Double Big Mac burgers at participating McDonald's for a limited time.
Zahu gui fito du
always reminds me of the fiesta, which reminds me that we can't fiesta. Containing COVID. Hey, good morning, Guam. I-94. My friend John Akfaji. 8:33. Thank you for watching the Facebook live stream. Share it around. And after we're done, like I said, go back to the beginning. We interviewed a lot of people this morning, and still more on the way. I wanted to get Christine Boleto from the Guam Chamber of Commerce onto the show. Good morning, Christine.
Good morning.
So I guess we were talking with Ricky, who's the deputy. I know he's a deputy over at GITA, and apparently there was a big meeting yesterday with members of the governor's business advisory council, and so I've watched the news. I'm a fan of KUAM. I saw that Nestor had interviewed you a couple weeks about the lack of dialogue, really, and it's been almost, unfortunately, adversarial between the governor and the Chamber of Commerce. I don't know what
But you had a seat at the table yesterday.
That's what we're told,
right?
Yes. So, it's unfortunate because it's we're not trying to be adversarial, and it's one of the things that we've been trying to do is reach out to the administration and ask that we have discussions on what would be most helpful to employees and businesses. Of course, understanding that public health safety is the first priority. We all agree with that. But there's people that have lost their jobs. There are businesses that are shutting down even before the mandatory closure, and so we were just trying to have the dialogue and express our concern and talk about solutions. Yesterday we were invited to participate in a teleconference. It was organized by David John and Ken Cook from the Bank of Guam, and so we had an opportunity to sit in on that discussion, which was a presentation by Ricky on, pretty much what he talked about earlier is available or is soon to be available, we hope, to businesses and employees.
So it wasn't an exchange of ideas. It was basically, this is our plan, or this is what we've got on our website?
Pretty much. We were asked we were asked if we had questions. Prior to actually this meeting, we as a group had exchanged concerns and brought up sort of suggestions. I believe that was presented to her, but of course she made very clear yesterday that her first priority is public health, and that she asked the businesses to hold on until the funding comes in from the federal government, and that she, along with her team, was going to figure out how that was going to, or how that can be of assistance to the businesses. Naturally, our concern at the current moment is that we don't know how long it's going to take for those initiatives to be put into place. And of course, there is quite a number of private sector employees that are facing payless paydays in the next few weeks. And so we're really concerned. I think from what I've heard from my colleagues in the business community, a lot of the businesses are trying to at least pay on the health insurance, because that's a concern if these folks don't even have, health insurance, and something, they're found to be positive and they can't seek medical treatment. So, in absence of paying them, they're paying their health insurance premiums. Some are not even able to do that. And so the other question and concern that came up is if these employees have already been furloughed or released, how can they avail themselves to the Family Leave Act, especially in light of some of these businesses won't be able to reopen. They, won't have been able to sustain themselves through this period. So there's a lot of unanswered questions. We still have a lot of concerns, but we do hope to continue the dialogue. Once the immediate public health emergency, is kind of subsided, and we can focus on economic recovery. But in the meantime, we're still going to, dialogue and attempt to get some local initiatives in place to help our people in the interim until this funding comes through.
Wow, that is kind of concerning. It sounds like you guys are just waiting. We're told to just wait for
the federal. Yeah, I mean, we talked about this 3 days ago. I asked the governor, "Hey, what are you doing to help these displaced workers?" And her response was, "Hang in there, hang in there, because Uncle Sam's going to foot the bill for everything, and we're just going to wait until we get this, trillion gajillion federal dollars. In the meantime."
Yeah, and that's what we're being told. But again, we're also bringing up the concerns, and we're really concerned about the people out there that don't have a paycheck coming and have bills to pay. Even though there's rental assistance, even though there's talk about mortgages being held, I mean, people need to buy groceries. They need to eat. They need to buy, personal items. And how are they going to be able to pay for that?
Right.
And so when go ahead.
Christina,
when you brought that up.
Okay.
When you brought that up during the teleconference yesterday, what was the response?
We weren't able to. I mean, it wasn't a discussion.
Did they mute you, Christine? Was it on Zoom?
It was on Zoom, but we all muted ourselves so that we could hear what was being said.
Right.
And again, so the meeting started out with the governor sharing, her primary concern with public safety, and then Ricky, provided us with the presentation of what's going to become available. And so, of course, we appreciate, I think everyone appreciates that, there is some initiatives that are coming through, and that, potentially later on we can access this federal relief package. But, of course, again, our immediate concern is what happens in the interim. And so the chamber has been pushing, as you well know, the reduction of the BPT, as well as payment of tax refunds, because right now we're only up to October 2019 payouts. And if there's any way that we can accelerate the payments, especially, just from my experience, January is when we get a lot of the folks who are eligible for earned income credit. A lot of the folks who are really in dire need of their money tend to file in that first couple of months of the fiscal year for their 2019 tax returns. And so, those are the ones that we need to get the money to as quickly as possible.
Right. Christine,
those are the ones. Yeah.
I wanted to ask, just when you guys went in the Zoom and the reveal came that, one of the two advisors on this whole thing was the governor's son, was it a kind of like or were you guys okay with that?
Well, he was the one that I believe him and David John coordinated bringing folks like George Chu, Phil Flores, Brian Artero. There's, a lot of some key business members out there. Mary Rhodes was part of the discussion. So, I mean, I think we appreciated, being able to, at least as the head of the Guam Chamber, we've not even had the opportunity to have that sit down. And so we appreciate, that was coordinated. And then, one of the things that we also discussed is that, understanding, again, public safety is first and foremost. As these executive orders come out that affect the businesses and the people that are employed by them, we ask that we be part of perhaps the review or a discussion before it's issued, so that we could use our networks to get information out. Because, the panic that ensued and right after the first shutdown came, and then, the questions, did it apply to restaurants that were doing takeout? Does it apply to wholesale? What about the businesses that service the military was not shut down? Right. If we had an opportunity to perhaps raise these concerns prior to those executive orders being issued, then we could help allay sort of the panic and the influx of questions and confusion that ensued after.
Are you?
So, go ahead.
Oh no, go ahead. I'm sorry.
No, she did yesterday agreed to that and asked that if, because things are happening so quickly that, if we're given the opportunity to review it, to just be timely in our responses. And, I think all of us are appreciative of that.
So were you able to speak at all?
I'm trying to remember things. She didn't have a lot of time. I don't recall us being able to speak too much while she was in the room, but after she left, we continued our discussions and were assured by Ken and David that they would, and as well Ricky was there as well, that whatever, concerns we brought up, that they would continue to relay to the governor. And so there's supposed to be another meeting called in the next week or so, so that we can have continuous dialogue.
Well,
do you know who her economic advisors are?
I do not.
It's a big secret, apparently, because when I asked for some names, I didn't get any names.
And this was the first time the chamber's had any sort of communication with the governor?
Yes.
Since
yes.
Wow, those.
So I'm not, like I said.
Maybe it's social distancing, Christine, is what it is. Maybe they're just doing that, doing extra social distancing measures with the Chamber of Commerce.
I think sometimes the Guam Chamber of Commerce is not the most loved and appreciated.
I know. What did you guys do? My gosh.
It's the BPT thing. I don't know.
I just took over in January, so I'm not sure if there was something that happened prior to my time.
I think there was something that happened that, hit very close to home for the governor, and I think that it's on you to kind of impress upon her that maybe you didn't have anything to do with anything that happened before January.
Well, I mean, definitely we've tried, and we've also tried to be very respectful and communicate our concerns without. I think sometimes we get caught up in letter writings and releases to the media of being real negative and just pointing out everything that is wrong. But our sort of our goal is to really focus on employees and businesses and to kind of be that voice for them and ask that consideration be given. Everything's happening so fast. We have so many things going on, but, we want to just make sure that that's at the back of everyone's mind until we can bring it to the forefront, that there's people already hurting. There's people that have already lost their jobs and not going to get a paycheck. There's businesses shutting down, even prior to this and may not reopen. And so, like I've expressed to some of the senators, and it's not just the administration, but we've talked to senators and said, look, guys, unemployment is appreciated, but you need to figure out something to give to businesses so that these employees have a job to return to.
Yeah, Christine, so has there been any revisiting of the governor's team initiative? And I think there was something like, you guys can pay 40% of your BPT stretched over 3 months during a full moon on a Tuesday.
Well, I think some people will take advantage of deferment. I think that it needs to go a little bit longer than 3 months, because right now we don't see that within 3 months, businesses are going to recover. And so, there's someone remarked yesterday, 40% deferment of zero in the last few weeks is zero, so they're not going to have taxes to pay. There's no business really happening for most of the industries, and there's not employees working. So, there definitely is going to be a reduction in collection for the government from businesses and from employees that, is necessitated, of course, because we are in a public health crisis. But, we need something a little bit more, because that's not going to help a vast majority of businesses that are looking to, stay open and bring employees back after this crisis is done.
Christine, how important is it for the governor? And again, I don't know if maybe it slipped Ricky's mind or the governor's mind to tell us who's kind of her economic advisors, but how important is it for her to hear from people in businesses that are, maybe an arm's length away from what she and the family got going on? Because that kind of seems to be the problem, is that she's not hearing those voices from, people outside that sphere of influence that she's involved in.
Well, I think the group yesterday is a start, but I definitely think that the more people that speak to the concerns that are going on, I think anyone in any kind of position they benefit from it, because then you can make decisions, and it doesn't mean that you're going to take that advice or that you're going to change what your decision is, but to at least understand it and be able to respond to it, I think is important. I mean, we're in a public health crisis. Everybody realizes that, but you need to have that communication with the business community and hear what they're going through and be able to respond to that, because again, when you ask them to hold on and they've already shut down, or there's no way they can.
They're holding on to nothing is what they're holding on to. There's nothing to hold on to.
And that's the concern, and maybe they don't know that. Maybe they don't know how dire.
And maybe they don't know that because they're not talking to people outside of the circle that they're in. Sorry, kind of common sense.
You got to figure out a way to get in that circle.
You got to get in. You're not in, Christine. That's the problem. We built this whole thing on people being in. And if you're not in, then you're out. And it kind of sounds like you're out.
Well, we're hoping to get in.
Yeah.
We've been invited in. We were part of the discussion yesterday. And
right.
So, I mean, if it's not me, then anybody on our executive committee. It doesn't need to be me,
right,
but
yeah.
Or anybody in who represents small business. That's the group that I was at Carmen's the night that they closed, talking to the employees, and I mean, it was just heart-wrenching. Those people lost their jobs, and that business could not survive past the implementation of that minimum wage increase. And I go out in the community. I'm at church, and people come up to me, and they're like, my hours were reduced. And again, this was before the shutdown, and so it really affects you to hear their story and to feel for these people. And so those are the ones. I think that the Guam Chamber is sometimes seen as just this faceless organization that represents all these big businesses, and that's all we care about is the bottom line.
And I think, Christina, to be fair on you guys' part, maybe there needs to be kind of maybe a new public relations approach where you show people that, yeah, it's not because, and I don't know what it is, but people kind of have that in the back of their head. They're like, oh, the big bad chamber represents all the big businesses. But I mean, maybe you kind of need to tell the stories of the people who are affected by this.
Mm-hmm.
I agree. That's something I hope that folks are starting to see is we're really trying to communicate who we represent. We're trying to improve our public relations, if you will. We have some people on our board that we've asked advice and guidance on, so that we could change that whole perception, because really 70% of our membership is small businesses. I mean, they make up the majority, and they have the loudest voice actually on that chamber. Even among our board of directors, there's a great number of people that represent small business. Mika from Infusion, you've got Jessica Barrett from Barrett Plumbing. We've got a lot of small business representation on them, and so the dynamics of the chamber has changed greatly. But we're again predominantly small business is our makeup.
Right. Yeah.
It's hard to keep track because I know that you guys have been writing the governor suggestions on how to deal with the economic crisis that we're experiencing. Have any of the suggestions you guys have forwarded been actually adopted?
No, I think she's been pretty clear from the get-go that with respect to the reduction of the BPT, that she was not. It's not even under consideration.
BPT forever was, I think, the quote.
Yeah, so we have thrown out there, can you meet us halfway? Can we do a 0.5? Because the private sector is already suffering. The government. I mean, I guess from our perspective, the more that businesses close and are not able to recover from this, the less the government's going to get in the long run. So the 5% is not going to make a big difference because you got 5% or 1% more of nothing, and so that message, I think, I don't know who her advisors are, but she's been adamant that that's not on the table. We've gotten a lot more, I guess, openness with some of the senators in the last few weeks, and so we just sent a letter to Speaker Barnes yesterday asking again that the legislature consider the reduction. We're aware there's a couple of bills that have been submitted, one from Senator Moylan and I believe one from Senator Titagui that calls for the rollback of 1% of the BPT. So we're hoping that gets traction in the legislature and that
What legislature? There's no legislature right now. They're on postponement until further notice. And I got word, Christine, just to kind of loop you in, that what we're hearing is that the rules and the legal questions are too great to deal with. And I'm hearing it would take like months to even figure out how these guys can have session.
Ooh. Okay.
I mean, but we'll see. That's what I'm told. Is that in looking at the rules and the ways that they can all speak at the same time, because it's not going to be like Zoom. You can't be muting senators' mics. So that's what I heard from someone, was that it's going to be months to even kind of dive into legally what the senators are able to do, how they're able to meet. But it's interesting because I don't think it's taken months for other. I think there's a couple legislatures that have figured it out, and maybe we just can't figure it out.
Wow. Yeah, that's news. Yes, as of yesterday, I was told that they were trying to consider how to do it through like the teleconference or to have session, but implement further distancing with
and that's what I think they're trying to go for, Christine. I don't want to tell you it's just going to be months period, but for them to do like a teleconferencing thing, what I'm hearing is that that's such a ginormous legal question that it's going to take months to even untangle that. But I also did hear that they're trying to figure out how to go into session in PPEs or
Yes, they might just have to do that.
They should be doing that already. It's ridiculous, man. I mean, this is not. I don't get it. I don't understand why. And I know Senator Therese Terlahi, Senator Tello Titagui, Senator Jim Moylan have all said, hey, we need to get into session. So we don't know, what the holdup is. But like I said the other day, imagine if the governor was just like, I'm just going to postpone till further notice.
Mm-hmm.
I mean,
we're here. We're taking every extra precaution. I've got my, hand sanitizer, everything wiped down, everything here. Our guys got their masks on.
Yeah, and it's funny because it's an election year, senators, in case you forgot.
Okay, let's Christine.
Right, yeah. Sorry, Christine.
Proceed.
Yeah.
I mean, are we ever going to get another call with you after this?
Why, sure.
I know. No, Christine, and really we just however you guys feel.
She's frustrated.
She's frustrated. No matter how you feel about the Chamber of Commerce, I mean, every voice needs to be heard, and you can't just listen to the voices that you're affiliated with. And I think that's the biggest problem, and that's all we're advocating for, Christine. I mean, we all have our personal thoughts about how things should be done, but at the end of the day, especially at a time like this, they need to fold in the people most impacted by the COVID-19 crisis.
And like you said, 70% of your membership is small businesses.
Yeah. We definitely feel for you.
Like I said, I mean, it's sometimes to just say 70% of small businesses, but let's talk about each of those businesses that employ people that may not make it through this crisis, and that's really where it's at. That's what we need to address.
Right. Definitely. I mean, there was a petition that's going around yesterday, Christine. I don't know if you saw it, but It was a petition being circulated by people who have been directly affected by this COVID-19 crisis, people who have lost their jobs, people who are dealing with reduction of hours, and they're circulating this thing asking for a different variety of payments to put a moratorium on that. So yeah, definitely we know that people are suffering, but I guess it's on the governor to whether or not she's going to acknowledge that and what we're going to do now, and not just pass it off to the feds. You know what I mean?
Yeah.
So what can you do? What are you telling chamber members? For the most part, since you guys don't necessarily have a seat at the table or really a voice, so what's the plan for the chamber?
So what we've been doing is disseminating information. So as we are aware of what is available as far as like the loans or any relief package, we put the information out and we make sure they're aware it's there. We also have been helping chamber members who are open and have like their takeout specials or whatnot. We're putting that out and asking folks to support these businesses and with still being safe, mind you, but to support these businesses that have been able to continue on with at least like takeout service. And so I mean we've really become just a funnel to get information out, so that if there's something these guys can take advantage of, then they will. Sometimes, I mean, we're there for them. They call into the office. Catherine, our president, shares some of the stories of people calling in and just venting about, what their situation is and what their concern is. And so, it's tough. It's tough.
Yeah.
Well, information is the new currency, apparently, and that we're seeing that. We're all just kind of waiting for this federal stuff to, be finalized. So, Christine, again, if you're getting hassled, they don't want to let you in the meeting, call us up and let us know, and we'll put it out there.
All right. Thanks so much, guys.
Okay, be safe.
Yeah, God bless you, and wash your hands. Okay.
Okay. Bye-bye.
Bye. Christine Boleto, the Guam Chamber of Commerce. Just pretty... I feel for her,
Yeah.
Tough.
She's a fighter too.
Yeah, she is.
Know.
Maybe that's part of the problem, is she's not like, okay, governor, you know what I mean?
Yeah.
But I mean, they obviously feel very passionate about what they're going through, and I think it's interesting, and what she was saying about the vast majority, 70% small businesses, and maybe that's kind of what they need to push out there. To maybe show some of these faces. That would be, my recommendation. All right. KUAM-FM at Agotni, Guam. It's 9 a.m. I really want to try and go down to Molesto and talk to Mayor Ernest Chargaloff and get a little grassroots on this show, since we've been focusing so much on the business economy. It's containing COVID. KUAM News. Good morning.
KUAM News Update.
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Be healthy. Be informed with ITD.
Buenas and Hafide. Thank you, Chris and Bree, for allowing us to perform today. My name is Eric Borja, and to my left is Mr. Ralph Lenneman, and we are Masaya Hoffa. He's really not to my left because we are actually practicing social distancing, and we're trying to do our part to help flatten the curve. So we encourage everybody out here on the island and around the world to stay home and do your part. And if you need to be out on the road, please be safe. If you need to go to the store and get your food and all that, we ask that you use a mask and use your hand sanitizer if you have any, and Clorox wipes. And also, we want to say, Sudus Masi, para todos si finena na responso, y médicos and enfermera, para todo matotsogwi para isla, Sudus Masi. This is a song I wrote a long time ago. It's called Sin Hagu, and it's dedicated to everybody that you love. And for that love relationship, this one's for you. Thank you. When I first saw you, girl, we put a big smile on my face. Then I said to myself, how beautiful you are. Then I got to thinking what it would be like to have you in my arms.
Don't want to brag about it. Love letter number 42, Guam's favorite, containing COVID. It's Friday. Yeah, it is Friday. 8 new positive COVID-19 cases. The downward spiral of positive results that the administration was hoping for has not materialized. Instead, it's been kind of what Dr. Felix Cabrera said it would be. And remember, he anticipated that the healthcare system on Guam would reach a breaking point by the end of this week or next week. And, that's some very bad news. And, made even worse by the fact that we keep getting more positive
cases,
COVID-19 cases.
8. I can't believe that.
Right.
People, you need to stay home.
Yeah, you guys definitely need to stay home.
I'm also wondering how many of the 8, though, are part of that new testing prioritization, the 4 groups.
Right.
Because those are the healthcare workers, the first responders.
The elderly with COVID-19 symptoms. But, we talked to Linda yesterday, and Linda had said that there was a backlog of samples that were taken at island clinics, and that those were going to, were in the queue.
I think it was 12.
Right, and so those were being tested. Again, and we'll know maybe at the press conference. It's so tough, with the media only getting one question and one follow-up question. We're put in a position where, are we going to like John Kim Poe for which question we're going to ask? It's kind of ridiculous.
Start messaging. What are you going to ask?
Yeah.
Create our own chat group.
And you know what I think it is? I feel like they're kind of maybe mad at the media, but, we're kind of the middleman. We're the middleman for the people of Guam. So,
and then they created a chat group I thought was funny, the press con chat group. But
it's a one-way.
Yeah, nobody can ask anything about it. It's just like, this is the time. These are the rules.
You only get one question.
Yeah.
Yeah. So, anyway,
I almost should I just remove myself?
Yeah. And it's nothing personal for us. It just makes our job of informing you guys that much more difficult, right?
But we'll keep going at it.
Yeah, we will. And I think we got Max on the line here. Wanted to talk about this Theodore Roosevelt situation. Max, good morning.
Hi, Max.
Hi. Hey, I just wanted to share an experience that I had earlier this week, listening to your show this morning about the 5,000 sailors that are going to be tested, and you had mentioned, well, here are Guamanians just kind of out here on the other side of the fence, cannot get tested if we have some symptoms. We're told we're only testing elderly, what else? Medical personnel and
first responders, yeah.
First responders. So what I experienced was I just went to the doctor just for other issues, and I was asked, "Do you have any symptoms?" And I said, "Well, I kind of have short of breath. I think it's allergies." At that point, eyebrows just raised and I was told to go outside the building. So, okay, I'm outside the building. There's no chairs, hot outside. I asked for a chair. They were very kind to bring me out a chair. The doctor comes outside. He explains to me that I cannot be tested because they only have a certain amount of test kits. So I understand. However, my concern would be I'm a responsible person, and I can go back to my place and isolate myself and know that perhaps I may have the coronavirus. However, how about other individuals? Are they going to do the same thing? Now, when a doctor tells you you're sick, you're going to take the doctor's recommendation, and if the doctor tells you, well, you've been tested and you're sick, you're going to go and isolate yourself because you don't want to contaminate your family, your friends, whoever may be around you. But when you're told, well, hey, we can't test you, so, sorry, but we can't do anything at this time. So you're going to go back home and kind of go about your business. So if you're kind of like that person that, well, I'm not sick, but I do have some symptoms, but I'm still going to hang out with my friends, or I'm going to, be around my family. So my question is there really a lot more people that have coronavirus in Guam than just 50, since we really don't have the test kits, and we're being told just to go home because we cannot test you, and the navies are getting 5,000 test kits to be tested. We're all on the same island. Shouldn't we have the same type of, response to
one Guam is, I think, what they said, but it really means one Guam for them, one Guam for us.
Yeah, and I'm concerned about that because, I drive down the street. Well, not just drive down the street. I go jogging, and I see a lot of the Micronesians. I'm not, pinpointing anybody, but I see a lot of Micronesians outside of markets just kind of talking, doing what they do, and I'm thinking, well, is there a representative that can help that community?
Right. So, Max, we had Johnny from the FSM consulate office, and yeah, they are putting stuff out there. But, to be fair, yesterday I was driving into Ganya, and I saw Chamorro's outside of a business, pretty close together, lined up to go into this business. So I don't want to, and friendly reminder, we're all Micronesian. I don't know, what you are, but that's the term for the region that we live in. So therefore, everybody who comes from this area is a Micronesian. But yeah, so efforts are being put out there. They're putting stuff. They're translating it into, Yappies, Kashryan, Chukis.
Yeah, exactly.
So those efforts are being made. Yeah. Hey, but Max, I wanted to read you this medical advisory that came out yesterday. It was buried in a joint information release. But this is a Department of Public Health, Social Services, Medical Operations team that issued an important medical advisory. And the advisory is this. Given the number of positive cases of COVID-19 accelerating on our island, consider yourself possibly exposed if you have recently traveled or attended any mass gathering, such as church, fiestas, small parties, or other gatherings within the past 14 to 30 days. Have you done any of those things, Max?
I've been to the grocery store, and I know shopping carts, you can, get contaminated, opening a door, things like that. I think that also needs to have more attention in just regular maintenance if you're an operation that is open to the public.
Right, and so let me give you the advice here from Public Health. The statement goes on to say, for the next 14 days, stay home, self-quarantine, and monitor yourself for symptoms. If you feel any of the signs and symptoms of COVID-19, contact your doctor or healthcare clinic. Some of the symptoms include, but not limited to, fever, sore throat, cough, runny nose, shortness of breath. Other symptoms can include diarrhea, abdominal pain, chest pain, headache, chills, and congestion, to name a few.
Yeah, I know all about the symptoms.
Right.
And, I just wanted to share the story about the 5,000 test kits for the sailors. That was all my point. I wasn't trying to single out anybody.
No. Yeah, I got you. Yeah.
People are very friendly and hospitable here. I mean, I'm the same way.
Yeah.
But I'm glad you said that they are being translated into different languages so everybody understands the urgency of this epidemic because, like you said, it could spread very easily among a group.
It has already spread too easily.
A majority of those cases are community transmitted.
Yeah.
No travel history.
Yeah, Max. And then, looking at the numbers, so they've provided more detailed demographics of these COVID-19 positive patients. I saw a spike in the positive patients who are in their 60s. And so we're not clear on, was there a cluster that they uncovered, or, is there some way that, because that's the biggest group of COVID-19 positive patients.
Right. And early on, they said that anybody who had contact or had visited the Hafaday Bingo in Tamuning March 16th.
March 6th through the 16th.
Right.
So a 10-day window. And we talked to the mayor of Tamuning. We're talking like thousands, hundreds at the least, thousands of people. We kind of love our bingo here.
Well, another something else you need to consider when the Philippines put the 72-hour travel evacuation for foreigners, or where if you were in the Philippines, you had to leave within 3 days. A lot of those people came to Guam, and that was before the 15th, before the 2-week isolation period,
right,
that if you travel into Guam. So you had a lot of those people come in from the Philippines that did not go into quarantine, isolate themselves. So you never know if they were infected on the plane or in the Philippines coming to Guam and then infecting others.
Right. I talked to a guy who came in a little bit after the governor announced the 3 positive patients. And so had he come in, 30 minutes on either side of that, it would have totally changed his circumstances.
Yeah, I agree. Well, how many? What's the population in Guam?
160.
Is it? I would say between 170, 200,000. We were trying to do a census.
No, I mean just the local people, not military.
I don't know. I would say 160,000, 170.
Is from what I'm seeing, I was doing the math. The average is about 10% of the population that's tested that is positive with this virus. 10%.
Right.
I know we're very low, but we're not testing people.
Right. Mm-hmm. Yeah. And
that's
just
how you just don't really know.
Yeah.
I mean, Dr. Felix Cabrera was on the air yesterday, and even a couple days before that, and he believes that it's just widespread.
Widespread. Yeah. He was like, it's widespread.
Yeah, I read that. I agree with him.
Yeah. So I guess wash your hands and go into self-quarantine, Max.
Yeah, don't kiss anybody, right?
Air kiss.
Okay, I'll try that.
Thank you.
Take care. Be safe.
Right on.
Thank you.
There you go. Yeah, that is, that's just the fact of life here. We got one set of standards, and talking about how 5,000 sailors are going to be tested on the Theodore Roosevelt. That's something else. And we're seeing it in the comments.
So far on Guam?
But we've had like 200. And how long has it taken us to test that many people? A couple weeks, right?
Yes. We started performing the test March 12th. So out of all the people that have been tested, 45 tested positive, 308 tests performed to date. 308 tests performed to date since March 12th.
Right, and so with that Theodore Roosevelt thing, that's something that we're monitoring pretty closely. The latest national media reports say that there are over 20 COVID-19 positive sailors on that ship.
Mm-hmm. And 4 were medevaced earlier this week to the Naval Hospital. They're on isolation. The Navy Secretary, Acting Navy Secretary, mentioned in that press conference at the Pentagon that it is pulling into port here on Guam. All of them are going to remain on the ship pier side. They're not going to be allowed into the community. So I'd like to, get more information. So what does this mean for people that live on the Navy base?
Right. Are there gonna be any COVID-19 forward posturing that's going to happen? I got a message. Oh, there's a comment here, Bree. Have the governor and her advisors made the decision to move GMH maternity to Guam Regional Medical City? I know you were working on that yesterday.
I'm sorry, I was looking at my messages. What was that?
We had a comment here. Has the decision been made to move the maternity people in the pediatric?
No. That wasn't even brought up during the press conference either. We had Lillian Posadas on the radio show yesterday,
right?
And she said that it was all still, in discussions. Nothing is definitive. Nothing's set in stone. So, and it's going to be, if they do it, it's a massive move. But we saw the video that we received, GRMC, And according to Dr. Tom Shea, you know, they're pretty much ready to go. It's 10 times the NICU is 10 times bigger than GMH's.
Right. I mean, some of those patients are going to be like, "Wow, we're in a Cadillac hospital now." I got a message.
And so, you know, GRMC is designated as the COVID-free hospital.
Right. One of my friends messaged me this. We might have to test the strip joints and massage parlors. How long did the aircraft carrier land, and with how long was the Liberty back in February? Is that a real concern to you, Bree? Do you think that there were any COVID-19 positive cases, or do you think that had there been at that time, we would have seen, you know, a wider spread? Or
well, okay, so I'm not sure when it was in Vietnam,
right?
But you know, I am concerned.
Okay,
concerned.
So that maybe we can add that to one of the list of things.
Because when did the president declare a national emergency? It was in February. I can't remember the exact date.
Okay.
It might have been after the ship, because the ship was here on the 5th.
Yeah.
The 5th, and so shortly after, I think he declared the emergency.
Well, for what it's worth, there's going to be no Liberty this time.
Right.
Yeah.
Right.
921, we're KUAM FM, Agotnia, Guam. It's containing COVID. We're going to take a break, do some news, and come back with Mayor Ernest Chargaloff right here on Containing COVID. Good morning, Guam.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information. GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Be healthy. Be informed with ITD. Healthy. Be informed with ITD.
The governor rattled off a series of federal assistance programs that Guamanians will be eligible for to be administered by FEMA and the Labor Department.
I also received word that the U.S. Senate package includes $111 million in direct assistance to Guam. Our federal contacts say this is in addition to other programs already in the works.
Details of the various assistance programs will be released in the coming days. The governor says she also met today with representatives of the business community and acknowledged their many concerns. She's tapped Guam Economic Development Authority Deputy Ricky Hernandez with coordinating the information about the available economic recovery initiatives.
So if you visit our website at investguam.com/coronavirus, there are presentations and resources there for our business community to take a look at. And you'll find a breakdown of each of these initiatives that are available. And as information on federal guidance becomes available, we will continue to work with our business community to get that information out.
Of particular interest to local residents is the direct assistance payouts to individual taxpayers and their dependents. There are indications that the payments are to be made by the state governments to be reimbursed by the Treasury Department.
I don't have detailed information about it. I don't know if they're going to be giving the monies right away so we can pay it. And your question of do we have the cash flow? I need to work with our fiscal team to get that information and to do the analysis.
Although President Trump has said he would sign the federal coronavirus stimulus bill, it must still clear the House. For Guam's News Network, I'm Nestor Lecanto.
Be healthy. Be informed with ITD.
Hey, business! Guam's favorite. Thanks for watching on the Facebook Live. Of course, the KUAM News takeover of containing COVID, day 12 of a public health emergency that has stretched into an extension of mandatory isolation orders and business closures issued by the governor, Lulian Guerrero.
In effect until April 13th.
Right. And, like we talked with Dr. Cabrera yesterday and all the stakeholders in the response to COVID-19. They're all saying the same thing. This is probably going to go beyond April 13th.
Right.
So dig down deep and find out,
Stay home.
Stay home, definitely. Can you go over the results, the demos and stuff, and then I'll get the mayor.
Sure. Okay, so these are the profiles of the earlier confirmed cases, and the way they release it from the Joint Information Center, it's always a day behind. So these are just from the 37 confirmed cases, which were confirmed Thursday. So 25 were in stable condition, 11 hospitalized, 1 deceased. The gender breakdown, 16 male, 21 female. Residential location, 11 from the north, 16 from central Guam, 8 from southern Guam, and 2 still under investigation for place of residence. As for the travel history, 1 visited Japan, 7 from the Philippines, 2 from the U.S. mainland, and the remaining have no travel history. The age groups, 1 is in their 90s, 2 are in their 80s, 2 are in their 70s, 14 are in their 60s, 5 are in their 50s, 6 are in their 40s, 4 are in their 30s, and 3 are in their 20s. And that is a breakdown, a profile breakdown of the results from Wednesday.
Let's get Mayor Ernest Chargaloff, Molesto in the house. Good morning, Mayor.
Good morning, Craig.
Mayor, so, we see that there are definitely COVID-19 positive cases in the south. We don't know specifically what villages, but have you heard anything about the COVID-19 positive cases in Moleso?
That's the only thing I've heard about, and I've inquired through the link if I can get an authentication of whether or not any of our residents are positive. And although they can't reveal the names, at least on the village by village, so that it'll prompt people to adhere to stay home, social distancing, because we can help ourselves. I've distanced myself to friends and family as well. I mean, even my staff. We don't know who's carrying the virus, and I think this social distancing can work. But I think the better option is to stay at home and weather the storm, because the more we expose ourselves to spreading the virus or contracting the virus, the more it's going to spread. So,
Mayor, when you asked them, are there any COVID-19 positive cases in my village, what was the answer that you got?
I haven't gotten any feedback today. I mean, I'm concerned because although I asked this during the briefing at the governor's conference, and public health responded that because of the privacy issue. So when privacy issues collide with the right to the public safety and their health and welfare, we're not disclosing the individual's personal data, just what they have, so that people can avoid contact with them.
And
if they don't want to give us the names, give us by village rather than region.
Right.
I can't believe we're still at this point.
I'm good dude. Sorry.
Because Mayor Luis Rivera and Mayor Hoffman, they were bringing up the point that when we had the dengue fever outbreak, villages were provided, and so I'm not sure why.
I mean, how is it, to tell us the region? I mean, you might as well tell us the village.
Exactly. I mean, in the south, if you were to divide the island by south, between South Central, I believe South incorporates Jonia and Pidi down to Mauricio.
Right.
Now, we wouldn't know, and like I said, knowing that the village in itself has infections already, it'll prompt the adherence to and heed the stay-home notice, because when you go out there, people should already have what they need to quarantine, self-quarantine, and self-isolate themselves. My other question was, are they in isolation or self-quarantine by the government, self-quarantine themselves with certain recommendations and agreements that they must stay home for a certain period of time? And if they violate that, then the onus is on the government to have a commitment order so they can isolate these people from spreading the virus any further.
Right, and that's a whole nother issue, because we don't get breakdowns on where people that are in home isolation are actually located. But what is your response, Mayor, to people who may say, it doesn't matter at this point, it doesn't matter what village they're from, you need to act as if everybody has the virus?
Yes, ma'am, but our actions can also come back to haunt us, because if we don't practice the ultimate, it's going to keep spreading. What is the best practice is to stay at home. If you haven't contracted the virus, chances are staying at home, you're not going to get it.
Yeah, but Mayor, you know what, Mayor? Our people, they forgot how to cook. They don't even know how to make coffee. You know what I mean? They have to go, they have to, Mayor, because, they cannot cook and they cannot even make coffee. They have to go get their, coffee. They have to go get their to-go order because, we forgot how to survive in the war.
Yeah, but Chris, at this point in time, like I said, the privacy right should be over-trumped by the right for the people to protect themselves and to protect the health, safety, and welfare of the people. Like I said, we're not revealing your assets and all your everything, except what you have.
Yeah.
It's a matter of panic, hysteria, and paranoia. When the dengue fever came about, all the insecticides were all bought out. And now when this thing, all the face masks, all the sanitation, all the Lysol, the hand sanitizer, all gone.
Right.
People are hoarding it to the detriment and denial of others. You only buy what you need to weather the storm. And hopefully, when you about to run out, you run out and get some more and hunker down again.
Mayor, going around your village, are the people of Moleso, are they listening to the governor's order?
Well, you don't see a lot of going about, and I closed down the park myself. So
So the pier is closed, right?
I closed it now. Enforcement, Chris, since the governor said they're closing all parks and beaches, although the park is under my purview. Ultimately, the governor is responsible for all government lands.
Right.
So
yeah.
I have to follow suit and follow her direction as well. And it's not because of a matter of authority, but rather for the protection of our people.
Sabrina was just asking me about the crab festival. I think she's craving crab, Mayor.
I was so distraught because
I know, it's sad.
Just a week before my event.
Yeah.
I mean, you might have run theirs, and I'm glad theirs are gone.
Right.
Now I'm faced with having to return the monies that I solicited, and then I still have to collect the raffle tickets because I have to run them because people bought with the expectation to win.
Right. Yeah, Mayor. So I know that's been postponed indefinitely, but that's a pretty big prize you guys are doing, and I'm pretty sure people are going to need that. So if I don't know what logistically what you got to do or legally, but I would just hang on. I think people are going to want to, have a chance to win that raffle.
We're going to be collecting, and we don't know if those that we're going to be collecting from are infected. So I think the better thing to do as far as judgment is concerned is to err on the side of caution and wait it out.
Right.
Because like I said, the more you move about, you don't know who's infected and who's got, and it doesn't really show right away.
Mayor,
it's a gradual thing.
Did you guys? Is there a national stockpile of stuffed crab down there that due to the cancellation of the crab festival that we were able to access?
I'm sure the ones that make it, Chris. But I've got a lot of crabs in Mauricio. They just have to come down and.
That's a lot of work. We're looking for the one that's good to go.
And right now, like I said, the crabs are available because I wasn't able to buy it from my crab hunters.
Right.
But these are things that are beyond my control. But they can still sell it. I mean, to those that love crab, they can still buy it. But like I said, the stay at home is the best remedy for the spread of the virus until because it's got a lifespan.
Mayor, I want to ask you: do you think that we should further lock down this island? More lockdown? Do you think we need to go the extra mile?
Isolated, Chris, if we wait out the storm and the time that it dissipates, and we don't continue to spread it, I think we can weather the storm. But as new cases come in and they're not locking down, that's everybody's entitled to their opinions. With me, my opinion, I'm a team player. Whatever the governor wants to do, and it's to the benefit for the people. I mean, it's the outcry from the people themselves that will prompt the actions of the governor. So who am I to disagree with her? And if it's for the protection of the health, safety, and welfare of the people, I agree with her. Now, the only things that I don't agree about is that certain things that I'm inquiring about, and I stressed it during the conference that I think, and when it conflicts the right to privacy, we're not, like I said, we're only revealing who you are and what you're carrying.
Yeah,
people can get away from you.
Mayor Ernest,
get away from you.
All the mayors have been saying this, since the beginning of this. So you're the latest one to kind of join in this call for more transparency, Mayor, and we appreciate that effort.
Yes, Chris, I supported this administration, but if decisions have to give us the opportunity to agree to disagree,
right.
I think when it comes to health, safety, and welfare, disagreeing at a given point is logical. That not everybody has all the answers,
Right.
We don't have all the answers, but collectively we put our minds together, our resources together, to enhance the promotion of weathering the storm. I think that's the most logical thing to do, is to put our minds together collectively, and with the concurrence and adherence by the people. We're so isolated, Chris. There's no reason why we cannot contain this within ourselves.
Right, yeah.
But as far as lockdown, I don't have the authority. I can say yes, I like that.
So you like it?
I would love it. I mean, we contain it ourselves until everybody gets the all clearance that they can travel, because Guam is a free virus-free. But you got to remember, the symptoms do not show right away. So we wouldn't know whether that person is already carrying the virus, but it hasn't shown the appropriate symptoms to be isolated or quarantined.
Right, the asymptomatic cases are the ones that we're worried about. Mayor, we got to run. I got the Archbishop waiting to talk to the people.
Chris, but if anything, you guys can relay, right? You see, we can push for village to village so that it will prompt our people to stay home.
Yes, Mayor, we're definitely, that's one of the things we constantly ask, so we're going to keep asking that, okay?
When's your next conference call, by the way? How often do you guys have your conference calls with the governor?
I haven't been given any thing. I'm constantly monitoring the WhatsApp.
So it's all over WhatsApp. So wait,
Yes,
you don't have conference calls with the governor?
I don't have.
In Molesto, that's what we call it.
So the mayors don't have conference calls with the governor. They get WhatsApp chats with.
Yes. And if I get the conference or WhatsApp, I'm computer illiterate and cell phone illiterate. So
that's why he's calling it a conference call. It's a group chat, Mayor. They call it a group chat. In the North, they call it a group chat. Thank you, Mayor.
When you show far away from
right
from all the modern technology, you have to learn a little at a time until you get up to their par. Huh?
Right. Yeah. Hey, I'm jealous of you that you're down there.
I know.
I hope you guys can push. Right? I've asked my mayor if we can all concur and we can all be updated as they develop. Not get last news first, because the people are asking us first before we ask first.
I hear you.
I got you. Yeah. Thank you, Mayor.
We can't answer anything we don't know about, Chris.
That's that. Okay.
Thank you, Chris.
Okay,
Take
Mayor.
Care.
That's that.
Thank you.
Okay.
Thank you, guys, and keep doing a good job, guys.
Appreciate it. Right, Mayor Ernest Chargaloff, the Southern philosopher.
These mayors, man.
I tell you, I love the mayors there.
I do too.
I like how they're out here.
Line.
Yeah, front line, and they're saying, hey, we need to know. We want to arm the people. And you know who knows the people of Guam more so than the governor, more so than the senators? It's the mayors.
Yeah.
They are the direct link to the village residents.
When there's an emergency, first people you call are the mayors.
Right. And so what these mayors are saying, they're not saying, give us the names, give us their social security numbers. Nothing like that. The mayors know their constituents, and the mayors feel that if their constituents know that there's a risk of exposure, that there's a positive case in the village, they're going to do what they have to do to shelter in place, to take this order more seriously. Right. So that's kind of what they're talking about.
And I know a lot of people are calling their village mayors, but the Joint Information Center, they also do have a phone number that you can call for whatever questions that you may have. It's 475-9473, 475-4770. Also, you can also give us a call. We might not have all the answers, but if you'd like to air out your concerns, our number is 637-0094.
All right, and so the Archbishop here, they got a cool Facebook page, Umatunas Idulas. It's he's got a message, right? This is a message from Archbishop Michael Burns, and this message is about perseverance during difficult times. Perseverance during difficult times. I'm trying to persevere during this difficult time, but this thing won't play, so let's try this again.
Perseverance during difficult times.
Maybe it was the
Archbishop Michael Burns.
There we go.
I'm going to have to say a prayer for you, dude.
Yeah.
Like, come on.
Hey, I light my candles.
What did you say? Day 10? Day what?
Day 12.
Day 12.
Yeah.
Still rusty with the radio.
And we're going to... It's not me. It's the equipment. 9:46. We'll take a break, and we're going to figure this out here on Guam's favorite, Containing COVID.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Be healthy. Be informed with ITD.
So
Blame it on me. It's
Yeah,
all
you
right.
deep
Blame
in-
it on Bree.
deep in your sinful ways. So you can go to the Catholic Church of Guam's Facebook page.
Umatuna si Dios.
Right, and they have I know in putting out they have a helpline that you can also call that we talked about at length with Polly Mike yesterday, and they're trying to put these messages out because
the faith.
right for people to keep
And
the
we're
faith.
also 1210 live streaming the masses on our Facebook page, and then we have the live broadcast on Sundays.
Right.
9 o'clock Sundays. The broadcast. Yeah.
Yeah.
Well, you'll find it on our social media.
We will.
pages,
It's
yeah.
9:48. Let's get Harold on the phone here. Harold, good morning.
Hey, how's it going?
Pretty good. So you had a what was it? A COVID question or a concern?
Well, just a couple of things to touch on. I think what we're all dealing with the governor's directive of staying home is that it really the bite's just not there. I just drove by Bank of Guam right now, and there's a line of at least 60 people wrapped around the building. But okay, so to my question, is the construction industry an
Exempted.
essential part?
Yeah.
I don't know if you covered it. I had put it on your Facebook page.
I saw that, Harold. I wasn't able to because I'm doing 5,000,000 things.
Oh, I understand.
yeah,
I understand.
yeah.
You guys are busy.
But the construction is an exemption. I guess construction is an essential business. I guess. I mean,
because I saw a Facebook post of a friend of mine, two guys, on a scaffold painting a building, and it's like that's not 6 feet apart. But just construction in itself, why are these guys out in public? Secondly, my next question was the issue with did you agree with the governor's response with regard to the quality distributor incident yesterday? Are they on the same vein or whatever as Payless? Because from what I gathered, there was a line of people outside that door.
Right, and I brought this up to the Gov in the press conference. I think it was either earlier this week or late last week, Monday. So when she told us that she was going to extend the mandatory social isolation and business closure order, my question to her was, what we're seeing as businesses try to kind of like wiggle around the closures. We're seeing. You mentioned Bank of Guam, so Bank of Guam, for example, they're only open. I don't know
They're
what
limited hours.
Limited hours, and I think there's just the one.
Now, the banks are
limited hours, and now only one, only the main branch in Agana.
Right, and so what I asked the governor, I
Everybody's
said,
flocking there.
exactly what this is creating is a lot of traffic, a lot of mass gathering, if you will, at these businesses. And so I said, are we gonna examine this? And her response was, there may be a situation where she does tell, and I use the example of banks, but I'm assuming this applies to other businesses that are allowed to be open, that she was going to say.
I'm saying, with regard to yesterday's press conference, the tone behind her voice of, they have a right to be in business. I think you're missing the point, Governor. There was a line of people outside quality distributors. How is that not social gathering?
Yeah, I mean, you got a good point.
You got to put somewhat of a lockdown on that issue. Lastly, and I'll leave you with this, and I don't know because the news reporters or the news isn't reporting it, but in this day and age with Skype and FaceTime, are the positive case people able to talk to either the media or even their family members?
Okay, Harold.
I know you don't want to create a panic out there. I get that from a certain perspective, but are they being able to communicate with the outside world?
Well, I don't know. I don't know if when you're being held in isolation. I mean, a lot of these are COVID-19 patients are home isolating. So I did see your comment. I thought it was interesting. I didn't really want to talk about it because, we're competitive. And I'm pretty sure all the media is trying to find that COVID-19 positive.
I mean, we spoke with Yoli, after Auntie Doring passed away.
Right, yeah.
And, I mean, I don't know if it's like the
those that have tested positive, whether they're self-containing themselves or at the SMU or wherever, do they have contact with, at the very least, their family to let them know on a daily basis, hey, I'm this, I'm that, whatever.
Well, if they're on home isolation, I would hope that there's somebody, there taking care of them.
But, with them.
Yeah.
I want to know, Harold. Yeah, I would love to hear from someone with...
Just thought I'd throw it out there. But I appreciate
thank you.
it. And that Bank of Guam issue is seriously an issue. The line wraps around the building. I just passed by there on my way home.
I went by there yesterday, Harold, and I saw the same thing. I mean, the employees look like they're trying to make everyone do the social distancing, but in doing that, they're having to approach customers, pretty much face to face or whatever. And I saw that too. The line was stretched out the door. People were not 6 feet apart. And, the governor's got to...
She's got a lot of decisions, a lot of...
Right. I think at this point... Yeah, Harold, thank you.
Take care.
Okay.
Take care.
All right. No, thanks. 637-0094. Yeah, I mean, maybe that's why a lot of the rumors are going around about, it was going around on WhatsApp, and they said it was false that the National Guard was going to be activated or whatever. And I think that really says something, and I don't know if maybe the governor is kind of timid about strengthening these orders, but what I'm seeing is more people are calling for it.
Yeah.
Like they want, I mean, you guys want martial law.
Don't.
I mean, no, I mean, they do though, because people are not taking it serious, and there's just way too many exceptions. And, if we really want to help avoid the spread, I mean, what's the difference between a regular person, staying home and a construction worker going out on the job? If we really want to help avoid the spread, then I think we need to, help avoid the spread, period. I don't think COVID-19's discriminating between, Tanana and Jigo, who's, self-quarantining because the governor said so, and, some H2 worker from wherever. Okay. So last word time, Bree. Are we ready for the last word?
Yeah.
Yeah, something going on there?
No.
Did you want me to do that thing that you with the governor?
What thing with the governor?
Okay, I saw you sent me something. No. Okay. So
she just finished her daily briefing.
Morning update?
Morning, yeah.
Okay.
I think we maybe should go ahead and play that.
All right,
if
so
you
let
can
me
cue that up.
Let me get that
great.
up. And did you want to maybe kind of last look at the JIC numbers or the positives and the tests and all that, or Theodore Roosevelt or something?
No, we've got 45 confirmed cases. 8 were confirmed last night out of 38 tests that were ran by public health. Overnight, we saw the press conference that the Pentagon held, where Acting Secretary of the Navy, Thomas Modly, told reporters that the USS Theodore Roosevelt was pulling into port, and we've already received so much information that it in fact has arrived to Guam. He also said that more sailors had tested positive. National media are reporting that there are more than 20 that have tested positive for the coronavirus. And additionally, he also told reporters that everyone on the ship, 100% testing, and there's over 5,500 Navy personnel on board the USS Theodore Roosevelt. 20, as we've been saying, are originally from Guam. They were just here, the whole ship, on Liberty in February.
Okay, so now I have the governor's morning update here on containing COVID, KUAM News.
If approved, this would authorize the president to provide supplemental federal disaster assistance. I have requested the following FEMA disaster assistance program. Assistance to individuals and households, which can include the following programs: individuals and household programs, crisis counseling program, disaster case management, disaster unemployment assistance, disaster legal services, disaster supplemental nutrition assistance program. I've also requested public assistance, category B, to include emergency protective measures, and assistance for local governments and certain private nonprofit organizations for actions taken to prevent or reduce long-term risks to life and property from natural hazards.
Be healthy. Be informed with ITD.
Contact of these sailors from both military and also from civilian people that are in the base. The base will still be open for commissary, and of course Anderson will also still be open, and so please be assured that we are containing the situation. And I also want you to be assured that we are containing the situation in our community. Again, I want you to stay home. I want you to make sure you follow what we tell you in terms of minimizing your travel in the roads. Again, you can go to the grocery stores. You can go to goods, household wares. You can go to small mom and pop stores.
Okay, I don't take it personal. I'm just going to cut her off because it's
we
just
gotta
like
wrap up
reading
the
press releases and stuff.
Right. So she did. One of the things she did say was that the USS Theodore Roosevelt, and confirming in fact that it docked this morning and docked the furthest dock from others was what she said.
That was funny.
Yeah, and there's 23 positive cases is what she understands. 23 at Naval Hospital. They've been isolated there.
Well, they've been isolated in the farthest isolation room from the main gate.
Now you made me lose my train of thought.
Yeah.
The sailors, where they're docked at the furthest dock from the dock of the dock, they are not going to be allowed out of the base, not even allowed out of the ship, I believe. It's just they're going to be quarantined in the pier area. The military commander on the naval base has assured her